Terry Hedrick, it is really good to see you again. You're muted.
After all these Zoom meetings, I still forget that I'm muted. Good to see you too.
Yeah, I'm so excited to hear what you guys are presenting today.
Yeah, it's great.
I didn't know you took a job with Partnership Health. Or have you been there this whole time and I just was clueless?
I've been there the whole time. It's a community facing, my job. So it was funded through the Montana Healthcare Foundation, but came through Partnership. So
very good. Hello, AC Davis. Good morning. Good morning, everybody.
Good morning, everyone.
Woohoo.
Hi, Stacy. You're the chair for this one, right?
I am.
Okay. We are, the webinar is live and we're live to YouTube as well. So we're good to go on my end.
Okay, great. Well, I think we'll give everyone the 2 minutes more to join us. All the troubles All right. Well, good morning, everybody. Today is Wednesday, November 18th, and I will call today's meeting of Public Safety and Health to order. We'll start by doing we'll do a couple quick announcements. So if you are joining us either on the webinar or watching on television, you are going to see on the screen right now an agenda and related documents. Website listing, that's www.ci.missoula.mt.us/webcast. That is where you can go to find all the ways to sign in and join our various committee meetings, as well as our Monday night city council meetings. It's also kind of the hub for everything you need to go. If you are here and joining us, you can, and when we get to the public comment portion of our meetings, there's a couple ways for you to let us know that you want to make public comment. If you are on the Zoom webinar, you can just raise your hand, click participants and raise and lower your hand. If you're calling in on a phone and you want to indicate that you want to make public comment, please press *9 to raise your hand and press *9 again to lower your hand after you're done speaking. If you would like to leave further comment on this topic or any of the other topics we'll be considering in various committee meetings, there's a couple different ways you can do that. You can leave us a voicemail at 406-552-6012. That goes to all members of the City Council, or you can send us an email at council@ci.missoula.mt.us. And again, this is broadcasting over our a couple different ways. Our YouTube channel, it's also on the city website, which you can access on that email or that website I gave previously. And we're also broadcasting on MCAT channel Spectrum TV 190. So lots of ways to continue to be involved despite the fact that we are continuing to meet virtually. So we will now get to today's agenda, but first we will do a quick roll call here. So I will read the roll. Anderson, I'm here. Becerra, I do believe, there she is. I see Mr. Contos.
Here.
Ms. Harp.
Stacey, I don't know if you want us to say present or if you're going to just read us off.
I was just going to read you off, but then you started calling for everyone started chiming in. So how about I'll just read you off to kind of get us quickly down the agenda today. So thank you, Ms. Harp. Mr. Hess is here. Ms. Jones is here. Ms. Merritt, I see as well. Mr. Ramos emailed and he is not attending committee meetings today. Ms. Cheryl is here. Ms. Fasika, yep, there she is. Mr. Von Lossberg and Miss West. Let's see. I'm running through my little Brady Bunch tiles on my screen. I do not see Miss West yet. Hopefully she will be joining us shortly. All right, we have a couple different minutes to approve from our meetings on both October 28th as well as November 4th. Does anybody have any changes or to those minutes? With seeing no one raising your hand, those minutes will stand approved. I'm going to take public comment on items not on the agenda. For those who have joined us, the two agenda items that we will be discussing that you will have an opportunity to provide comment on later on are, we will hear an update from the fire department on the mobile crisis unit, and we will also be discussing the proposed ordinance to regulate the sale and flavored tobacco. And that will be our second agenda item. So if you are in the audience and you would like to make a comment on something, not one of those two items, that's under the purview of public safety and health, please raise your hand. And looks like, and I'm going to call out what it looks like, the screen name on it. So it's Mike Kiefel 13. You have public comment on non-agenda items?
Yes, Ms. Anderson, this is Michael Keefe. I'm a resident of the city at large, although I currently reside outside of a ward. I wanted to know if we were going to do anything about the tremendous obesity pandemic that is crippling our school children. 20% of teens are now obese, with candy-flavored candy and drink-flavored drinks remaining legal for law-abiding consumers. I also have another separate matter. Recently, there was a fire in a mobile home park where the fire hydrants were not properly purged of air after they had been maintained by a contractor, and it caused a total loss of an entire structure, which I was the initial responder to. And I was hoping that there might be some measures put in place to ensure in the future that when fire hydrant lines are accessed after a pump has broken down or something like that, that steps are taken in the appropriate ways to get them put back in proper service. Thank you.
Thank you for that comment, and I will look into the fire hydrant issue. All right, anybody else? Does not appear that we have anyone else interested in making non-agenda item public comment. So we will move into our first agenda item, and we have so today we have a pretty long public safety and health meeting scheduled. So we're gonna let the fire department give us an update on the mobile crisis unit. We're gonna take about 30, 40 minutes, somewhere in there, depending on how the discussion goes. We will then leave the remainder of the time to discuss the ordinance banning the sale of flavored tobacco and just moving the display of tobacco products. And we will take a break somewhere in the middle of all of that to give us all a moment, because it's a long 3 hours first thing here in the morning. So I'm going to turn it over to AC Davis, and I'm not quite sure who is there else with him, to present on the mobile crisis unit, give an update, then we'll have an opportunity for council members to ask comments, and then the public as well. So AC Davis, it's all you.
Thank you, Stacy. Good morning, everybody. Brad Davis, Assistant Fire Chief, Missoula Fire Department. If you guys have difficulty hearing me through my mask, just let me know. Randy and I can put some distance between us. I do have Randy Ocon sitting here with me. He is our temporary program manager for the Missoula Cares program. I also invited Terry Kendrick from Partnership Health Center to join us if you guys have any questions that these two can help me answer. I am aware of your long agenda items, and I'll be respective of your time, but I did want to take an opportunity to get in front of you guys and let you know where we are currently at with this mobile crisis response unit. I don't have any presentations today. We had our first, this is an exciting week for us. Monday was the first day with our mobile support teams going live. They responded to their first calls on Monday of this week. And so we don't have a lot of data to present to you at this time. We just got going on Monday. And I just wanted to take an opportunity to field any questions and just kind of talk about the program a little bit with you guys. It's been a whirlwind. It's been nothing short of miraculous what our admin team at Partnership Health Center and our team of EMTs and licensed counselors have been able to do, and Randy kind of leading that charge in this short amount of time to be able to purchase equipment, onboard personnel, training, drafting protocols and procedures, trying to get this thing up and running in really just 2 months, possibly. I mean, I guess looking at 2 months. And so that's kind of where we're at. And we were able to get the van on its first run on Monday. So that was pretty exciting. Randy might be able to tell you a little bit about what they responded to over the past couple of days. And really, I just wanted to get in front of you guys and let you know where that process was, and we do a little question and answer. I know we've been fielding some questions from the public. We've been trying to get a consistent message out via press release and in the media a little bit, and things of that nature. So I really don't have much more than that. I really hope we have some questions from you guys that we can address or answer. If there's anything you want to hear about the program, between Randy and Terry and myself, we should be able to answer all of your questions. So with that, I'll go ahead. Terry, do you have anything to add before we receive questions?
No, that sounds great, Brad. Just looking forward to getting the questions from the committee.
Thanks, Terry. Randy?
No, just the excitement of getting this mobile unit up and running is pretty neat. I have somewhere in the neighborhood of 10,000 calls with my service at the fire department, and Monday was pretty spectacular in that list of 10,000. It was one of the highest points that I've had at the fire department, to be able to serve our community in a different fashion. So there's a lot of excitement at the fire department and with our cooperators of how this unit can better serve the customers and the agencies that we're interacting with.
Great. Thanks so much, Randy and Brad. Actually, if you wouldn't mind, I know that everyone on council, we're well aware of the process and the steps that got to this point, but just for those who are in the public who are tuning in today or watching, if you could give a kind of a brief history of how we got to this point, what the mobile crisis unit is, what it's meant to do, just kind of take this opportunity to do a little bit more public education, I think would be a value.
Yeah, absolutely, Stacy, and kind of thank you for that, Prod. So the way this established, the county was successful in receiving grant monies from the state of Montana DPHHS and the county travel matching grant. And once those funds were secured, and with contribution of funds from the county, Missoula County, and the city of Missoula, Missoula County went out to bid for a contractor to provide a mobile crisis response for Missoula. Missoula Fire teamed up with Partnership Health Center And we put in a proposal in response to the county's bid, and we're successful in being awarded that program for a 10-month pilot program to provide mobile crisis response in Missoula. And we were successful in getting that in September. And once we were successful in that RFP proposal is when we got to work hiring personnel and building this program. So our proposal included a rough outline of what we were going to do as the contractor and what service we were going to provide with that grant money and the city and county money. And we've had to build from that. And so from September until going live yesterday was building policies and procedures, stakeholder meetings, meeting with police department, sheriff's department, Missoula Rural Fire, MESI, and all of the hospitals and mental health facilities in town, hiring personnel, training personnel, and drafting and getting the equipment, specifically the vans and the radios and the mobile data terminals and EMS equipment for the EMT provider on there and some other equipment on the van. So they have the supplies they need when they're mobile, interacting with our community and clients in need. And so that's kind of been what this has been the last 2 months to get us to this point is building that program. And essentially we've leaned on a few other agencies, Cahoots out of Oregon. We took a trip over to Spokane. They have a behavioral health response unit that's been operating for just under 3 years out of the Spokane Fire Department, partnered with a healthcare provider, Frontier Health in Spokane. So our team went over there to spend a couple days with them to see what they were doing and try to adopt some of their lessons learned over the last 3 years. And we've been working with Colorado Springs Fire Department, who also has a similar program, and also kind of reached out to Albuquerque as well, who has a program that's similar to what we're trying to do in Missoula. And so taking all that information and then building this program for our community to fit our needs in our community with the input of those other agencies has kind of gotten us to this point where we are today. And so now that we are responding to incidents and are able to start tracking and gathering that data, we have until the end of this pilot program to basically prove that this system is effective and efficient and can relieve some of the burden off of the first responders, police, law enforcement, fire, and EMS, and also provide a better service and a different service to our community that hasn't been available to them up until this point.
Great, thanks so much. I think that background is super helpful, and it just really shows all of the work that has gone in to get us to this point, and it's sounds like it's pretty monumental. And I think it's really important. We got a lot of these questions during our budgeting cycle on council. There were 10 months. Why only 10 months? And it's because we budget calendar years, and they were getting started after the calendar year had already, we budget in fiscal years. And we're budgeting for the remainder of the 2021 fiscal cycle. This is not just a 10-month sort of thing. This is just getting us going. Hopefully we'll be a long-term investment in our community and its needs. So thank you for that. I'm going to turn it over to my council members to ask what I'm sure will be some really insightful, good questions. But before, I want to note that Heidi West is here for the record, and I'm just going to go in order that I see your hands up, and it looks like Ms. Hart was first.
Thank you. Just first quick question, because I'm having some speaker technical difficulties. Can you all hear me okay? Okay. Did everyone hear Stacy okay when she was talking? Okay. So there's something on your end, Stacy, microphone wise. Okay. All right. So thanks, Terry and Brad, for being here today, and Randy for that matter too. One of the questions I have that kind of is just real a technical one. The hours in which you plan to operate this team, being normal business day type of hours, how was that decision made in terms of the team itself, and how does that relate to the corresponding calls for service that you might receive?
That's a great question, Heather. So I did not add, kind of what we're doing is right now as we're continuing our training process and getting everybody credentialed and certified and and comfortable, we're working just 5 days a week, and we're working from 10 a.m. till 8 p.m. That's our schedule right now. And we're going to, as quickly as we can, transition to 7 days a week coverage, working 10 a.m. to 8 p.m. And the 10 a.m. to 8 p.m. came from looking at both through 911 dispatch. They have a code MH1 for a mental health type of call. And then through the fire department, looking at our highest call volume peak. And it tends to be in that 11 a.m. to that 6 to 7 p.m. And then also the mental health type of calls seem to be higher in that late morning to early evening time frame. And so that's why we started with the 10 a.m. to 8 p.m. schedule.
Great. And then I guess a small follow-up question there. If someone has an issue after those hours, what would you recommend people do?
Great question. So currently, up until this unit's been available for years and years and years, law enforcement and fire and EMS have responded to mental and behavioral health emergencies. And since this program is not available 24 hours a day, 7 days a week, and the possibility that these units can be busy on other calls, even during the time of day when they are staffed. And when that occurs, essentially what will happen is fire, EMS, or law enforcement or the appropriate agency will respond to this individual in crisis or in need. And we've built a referral process where it's a quick QR scan where the police officer or the EMT can scan it, and it sends a referral to our Missoula Cares program. So then we can follow up with that individual the next day when we come on to shift. And so, and if that's not an option, if we have to transport them to a higher level of care, then we'll transport them to the emergency department like we've done for years and years. But we're hoping that with the referral system that we'll have in place and the follow-up and trying to get these mobile support teams out and interacting with individuals while they're not in crisis can hopefully deter some of that crisis occurrences by being ahead of it and preloading that with our follow-up and referral system and getting them into the appropriate resources to help with that. But that is the option right now. If it's after hours, is the first responders that are interacting have a very quick and easy way to refer that patient to our program so we can follow up and meet their needs the following day.
And if the chair will allow, I have just two other questions, trying to be cognizant of everybody else. Terry, perhaps this is more of a question for you, but I start thinking about what kind of data gathering are you trying to collect when the team goes out, in terms of trying to ascertain, is there some kind of commonality that might be present through some of these calls in terms of whether it's age, income, you name it?
Thanks, Heather. You're right. We're wanting to collect data to see, that it might help us identify another need that's not being met in the community that may cause folks to continually be in a state of acute crisis. And so we are gathering that data, not wanting to overload folks when they're in a time of crisis, asking them too many questions, but really trying to get at some of that age demographic and then what's going on with them. I do want to follow up on what Brad said. I think a great part of this program certainly is the mobile response team itself, in terms of the clinicians and the EMT going out on the calls, but we also hired a person to do follow-up, a case facilitator the next day, so that folks won't be overloaded with referrals to agencies that they could go to in town. That this person will also help them access those resources. So as Brad said, after the call is made, when the mobile support team isn't on duty, the case facilitator will still follow up the next day on those referral calls too.
I might save my last question for our council president, because I'm sure he and all of us are kind of thinking the same question in terms of the response to the most recent tragedy, but I'll save that for you, Brian.
Okay. And as serendipitous, Mr. Von Lossberg is the next up in the queue. Is my audio coming through okay?
It is.
Okay. Momentary glitch. Thanks so
Hey,
much,
Brian.
Mr. Von Lossberg.
Brian, I super apologize. I have to run and pick up a kid. Can I make a really brief comment?
I take my slot.
Okay, I'm so sorry to do this,
No,
but
no.
I just wanted to just share my sincere thanks with AC Davis and Randy Oken and Terry Kendrick for the hard work. When they said that they were going to get this up and running in 6 to 8 weeks, I was like, oh, that sounds like a tough job, but you guys have done it and it's amazing. And I'm so happy to hear about the follow-up that you have planned as part of the program. I think that is one of the things that is so sorely needed, and that it's just so obvious that we have so many people in our community that really deeply care about all of the other people in our community, and I'm really grateful for all the work that you guys have done. Thanks, and I will be back just as soon as I can. Thank you, Brian.
Yeah, no problem. Stacy, okay to go?
Yep, go for it.
First off, thanks Terry, Randy, and Brad, and Randy and Brad. Thank you for the masks. We can hear you just fine. Really important to be setting that example everywhere. So I really appreciate you guys wearing those. Heather, a couple things, if it's okay with Stacy, and Heather kind of touched on, and your response touched on the first one. Council appropriated additional funding beyond the match in the grant. And I know Brad was probably sick of talking to me on phone calls with Dale and stuff. But I wanted to make sure that that additional funding beyond the match was helping expand the time frame, the days of the week. And I know there was sort of an initial conception of 2 teams, and we had a lot of talks and brainstorming about the additional funding that council appropriated to basically help you get up and running, 2 teams as fast as possible. But I just want to make sure I'm understanding that. Is it that additional funding that is helping you move to the additional days sort of model that you described?
Yes, Brian, and thank you, for the council support. And that's exactly right. As we drafted our proposal, we were going to start with 1 team and then try to phase in a second team later on throughout this pilot program. And we heard pretty loud and clear from the county commissioners and city council that we wanted 2 teams as quickly as possible just to meet the need. And so with that additional funding is exactly what happened. Funding was part of our issue. The other problem was the workload and the onboarding and finding personnel, hiring personnel, training personnel, and getting them up and running as quickly as everybody was wanting was the other challenge. And one of the reasons we were going to do that phased approach. But once we heard the need and the want from our administration and our council, and the extra funding was able to get us to where we are now, where we have 2 vans covering, and we're going to be providing that 80 hours a week of coverage with 2 units. And so that funding was instrumental in allowing us to purchase an additional vehicle, which was one of the big needs we needed right out of the gate. And then Randy, I drug him out of retirement to manage this program. And I just knowing there was a huge operational lift that needed to occur to get this program off the ground and up and running in such a short amount of time. But unfortunately, he wants to go back to retirement. And so I am going to post a position this week, hopefully, to hire Randy's replacement. I have him built into this program with the grant funding through the end of February. I hired him for 6 months to get this thing up and running. And this employee will take over for the fire department and take Randy's spot in managing the Missoula Cares program and working directly with Partnership Health Centers administration team to continue to manage this program as we're moving on. So absolutely, Brian, that funding was instrumental. And we just, I appreciate you guys recognizing the lift. It's been nothing short of amazing what Randy and the team at Partnership have been able to do in these last 8 weeks. So thank you.
Yeah, no, we're deeply appreciative. And my one other thing, and I think it probably touches on what maybe Heather was referring to. So I was going to ask, generally speaking, Randy, probably best directed to you. to the extent that you can describe the first call or calls and what was different, like what happened differently as a result of having this resource in place from what would have happened under normal circumstances before. I think council and the public's just interested in understanding like what were the different things that happened as part of the response. And then clearly we had a tragic event happen with an officer involved shooting. I want to respect the process that goes on with that, but to the extent that you can comment about the role of the response unit in a situation like that, I'm sure it's top of mind for folks.
Yeah, thank you, Brian. So just a quick rundown. I can't give you too much information because of private health information rules, right. But so our first patient was a well-known person in our community that is homeless. And our contact was through the police department, was the request of a police officer, one of the downtown business district officers, requested us, and we were able to come and visit with that person and de-escalate the person's state. And through that visit, we learned that the medications that the person needed to be mentally well was sitting at a pharmacy. And because of some problems with the transportation, she wasn't able to get transportation out to that. So we arranged the pickup of the medications. And then yesterday those were delivered, and understand through some other people that had contact with her that today she's in a much better state mentally, able to manage herself and be a member of our community and not utilize the 911 system. So I think the officers have had great contact with the person and would have gotten to that position just through our resources, especially going back to that case facilitator point. That helps us do that facilitation portion. And then what it really did in that specific case was allow two police officers to clear that earlier, while we spent about 30 minutes with the patient. So that allowed them to get back into service. One yesterday was really nice. Was a person that was having some suicidal ideations, and there was three officers there. We again responded to the request of PD. There was 3 officers there when we showed up. We took a quick briefing from them. This determined the scene was safe by visiting with the police officers and a quick interview with the person. So those 3 officers cleared. One of them, I don't know what they were going to, but turned their lights on and sped away to obviously something very emergent. So it was good to see that we could clear that officer up to respond to something that was emergent in our community. And then we were able to visit with this patient with our clinician and determine it was a serious event, and then transport that patient to St. Patrick's. And then our clinician was able to do that nice handoff with the social work department at St. Patrick's, wait with them until they were ready to receive the person, and then do that handoff, which is just a better continuation of care when a clinician's talking to a clinician. And PD didn't have to wait. So we were about an hour and a half, an hour and 45 minutes scene time, transport time, wait time at the hospital. So that was an hour and 45 minutes of police officer time that was able to be cleared up to be able to available to the community. And then late last night, we had contact with a person who was called 911. And originally it was a police officer, fire engine, ambulance request. So there's quite a few resources in Missoula that were being dedicated to that. Our team got there. Our paramedics determined that it was not a medical emergency and handed off to the team. Everything was safe, so that allowed the fire engine and the ambulance to clear and go back into service. The police officer stayed with us just as a scene security waited outside, just to give us a hand. And we worked through that with that person a couple times. And then just to go back to Heather's point really quick, kind of the hours look. So this was late. This was, our last contact was about 7:30 last night. it was a medication issue is what we were trying to help this person with. And the clinician that the person had that was supposed to be delivering the medications, we couldn't get a hold of. And so that kind of speaks to the hours why we chose to shut down at 8 o'clock, is in those evening hours, a lot of the services that they're using and that we're using to refer to are closed down and not available to us. And so that limits us back to emergency rooms as a primary place to go. So it's just the bang for the buck on the hours. Is we can, during the day, we have a lot of resources and a lot of connections to make. And at night, we go back to mostly the emergency room is an appropriate place to take them. So in that case, we worked with that patient twice. They called back and we were able to work with them and keep them in their home last night. And I guarantee that would have been a transport to the hospital, and prediction that there would have been no benefit, have been 4 or 5 hours of frustration for the patient, no different outcome for the patient, and sent home. So there wouldn't have been a predictable benefit to the patient to go into the hospital, but that was the tools that the ambulance and the EMS system would have had. So having our clinician there and be able to work with him, we were able to keep him in his home last night, which is a benefit to our 911 system, the hospital system, but mostly a benefit to the patient. That's where they're going to be most stable and mentally healthy.
Got it.
So that's kind of a quick rundown of the calls that we're seeing and the successes. I'm guessing, I haven't run numbers yet, but I'm guessing we're probably somewhere in the number of 7 and 8 hours in the last 2 days of law enforcement time that we've been able to give back to them and not have dedicated to these calls. Yes, sir.
I'll just jump in, and I know others have questions, and you were probably going to speak to the incident, the officer involved shooting. Just to preface that, in those cases, what I'm hearing is first responders making a determination that it's safe and in the interest of the situation. Pardon my lack of articulating that probably perfectly. To bring in the mobile crisis response team. Is that an accurate sort of description of the process that happens when we have emergent response situations?
Yes, sir, that's correct. So looking at the equipment, the training of our personnel, what they're really meant to do, research around the United States of different mental health response programs, and honestly, some of the problems that they've encountered, some of the tragedies they've encountered. We're very employee focused. Our primary focus is to keep our EMT and clinicians safe so they can be back tomorrow to help more people. So we have decided to go with a model that it's at request of one of the emergency response agencies in Missoula. So the unit will respond at the request of police or sheriff, fire, EMS. That can happen upon dispatch. So yesterday, the dispatch came in, the officer recognized the address and was able to ask for the mobile support team to respond right away. And they're a code 1 van that responds, so it takes them some time. So they were able to be at the scene in a timely fashion. The officer ensured that the scene was safe, that the patient was in a state that was safe for our team to interact with them. And that's key, that our people are arriving to a scene that's safe and can have the positive effect that they're able to do. And so we're working really closely with Missoula Police Department and appreciate their administration and their efforts so much on this. It's been very nice. And they're really looking out for us on those scenes. And one of the key things that we're looking at to help these patients is the number of responders. We typically in the past have really overloaded scenes to provide all these different level of cares and understand that sometimes is a trigger to patients or doesn't ease things up. So like last night, the officer just held on the corner of the building, was just in our back pocket, available for us, but not in view, and our clinicians could really do some work that way. So yeah, and to speak a little bit, I don't have details of the officer involved shooting, but to speak a little bit of the details that I do know and believe are true. That was a very quickly escalated scene. Definitely, if we would have chosen a different model and one of our clinicians was the first one to open that door, it wouldn't have been a good scene. We just don't have the abilities to protect ourselves, to de-escalate in that fashion. So, and it evolves so quickly that I don't see an opportunity for us to have been, staged and then come and take a positive effect on that same.
Thanks very much, Randy. And I appreciate it. That answers my question. I know others have questions. Thank you.
Okay. Thank you.
Great. So much. So I can take the privilege as a chair here. I just want to make sure that the public understands kind of the order of operations with the mobile crisis unit. It's if you are with somebody who you feel is in crisis that would be best served by the mobile crisis unit, it's not calling a separate number. It's still calling 911. And then the normal processes of dispatching of fire and police will come and assess the situation and then request the mobile crisis unit. So there isn't, for those in the public and just to understand, a separate number to access the mobile crisis unit. It's still 911 is the point of contact for anyone who's having crisis in our community. And then that the responders will then assess what's best needed, correct?
Yes, Stacy, and that is correct. And there's been a lot of conversation on this response model, and I just want to make sure that I say this out loud for the public and for the council members as well. Is as we're approaching this, we're approaching it with safety on as being the first part of our priority. But we are also, you are correct, is 911 is the number to call right now. We talked about a separate line. Typically a separate line, even though it's a different phone number, still rings to 911 dispatch and the same individual answers that phone that answers the 911 call. And we decided that 911 is a number everybody knows and is the number to access the system. That being said, as we progress with this program, we are looking at calls and we are looking at 911 dispatches that would maybe be appropriate to send the mobile support team and not dispatch all of the other resources. That's part of our data collection that we're looking at. And just as Randy spoke, the call last night, when the individual called back, we did not send a full complement back to that individual. The mobile support team was able to go over there and not send fire and medical. And so with safety being our priority and this being a brand new program, we're taking a cautious approach and we're going to collect data. And as we do these follow-up calls, it's very likely that our case facilitator, and this morning, so they're going to go visit that individual this morning. They're going to go over there just as the van. They're not going to be going over there with an ambulance and everything like that. And so as we do these follow-up cases, and I believe as we get to a point, as we get to know the call types and everything, we're erring on the side of caution now, but we're continually monitoring that system. So if somebody was to call 911, I don't think it would be out of line in the future at some point, where if they can talk to a dispatcher and tell them that I'm having a mental health issue, I'm not going to hurt myself, I'm not going to hurt anybody else, I don't have any weapons, this is a mental health issue only, I think at some point we'll be able to just send just our mobile support team without having to dispatch up cops and ambulances and fire trucks. So it's a model we're looking at, and we're trying to build a program that meets our needs as our community. There's models out there that respond. It's a private entity. They have their own phone number. They're completely separate from dispatch. They respond to all sorts of calls without police. There's programs out there where the clinicians are riding in cop cars or they're riding in fire trucks and responding with them that way. And there's models out there where they're doing that co-response, kind of what we're doing. We're trying to take all of that into account, build a program that's appropriate for Missoula, for our citizens, for our community, which is best outcomes for our clients and keeping our personnel and our employees safe.
I appreciate that explanation and that care that you guys are placing on that. So Ms. Becerra, your hand is up.
Thank you. And AC Davis, you read my mind because I was going to ask you just about that. So I appreciate it. Just a couple of things that I wanted to say. One is I'm incredibly proud and grateful to live in a community where collaboration has produced these mobile crisis units that I think are so needed in our community. Thank you for deploying them so quickly and so professionally. I wanted to ask you, so right now we have 2 units, and how many team members usually go in one of these units, and what are the areas of expertise?
Yeah, thank you for that question. So the units are a team of 2, 1 fire department civilian EMT position, and that's the prime. So they'll be EMT. Their job focus is the handoff of the patients from, if it's a EMS call that's getting handoff, so handoff from the paramedics, and continuing evaluation and care of the patients. Their job is also, as a city employee, to operate the vans, operate the radios, operate the mobile data terminals. So the operationally getting that unit there. And then their biggest job is that scene safety. The other person on that team is a licensed clinician, so licensed clinical social worker. And their focus is that mental evaluation and mental care. So as that clinician is doing their evaluation of the patient and taking that data in, our fire department EMT is keeping that scene safe. So they're staying back, keeping the big picture on the scene, understanding where the egresses are, exits, working with our case facilitator on the phone in the background as we start identifying needs. They're kind of doing some of that background assistance to the clinician. So that's the team of 2. So we have 2 FTEs on the EMT side that are filled by 2 people. And then on the licensed clinician side, we have 2 FTEs, and that's filled by 3 people. So we have a full-time FTE and then 2 part-times that fill that to make up our 80 hours.
Great, thank you. And just a quick follow-up.
Yes.
So when you say you follow up with the person who is in this situation, I'm wondering if, oftentimes the whole family might be involved in a situation. You have children, you have a spouse. Does the follow-up also include the household or the other members of the family, or is it focused on the person that you provided services to?
So ideally, it's in that family environment to wholly serve that patient. We do have some HIPAA and private health information requirements. So if the patient does not want other people involved, we have some of those restraints that we work through. But understanding that support for the person is one of the biggest things that can affect their lives. So wrapping that support around them in the best way we can. And maybe Terry, I'm looking at you if you have any other from the partnership side.
I just wanted to agree with what you said, Randy. That's really true, is that one of the keys is to look to see, does the person have a support system? And that support system is really critical. So, but as Randy said, it really is up to the patient, so that we're really wanting to provide the best care for that person at the time, and then having them be able to control some of that follow-up, what that would look like for them.
Great. Thank you.
Yeah, thank you.
Great, thanks so much. Miss Cheryl, you did have your hand up. Did I accidentally take it down, or did you do that?
I think you accidentally took my my hand down. I think all of excuse me. I think all of my questions have been answered, but just a couple quick comments. First, nice job getting Randy to come out of retirement, and thank you for doing that. This is, I think, Ms. Anderson stated earlier, a monumental kind of change, and I think that it is a monumental task that you've achieved in a very short period of time. So I know that the other calls did not stop, and so I really appreciate that you were able to do this, and just thanks for getting that together, because I think it's so important for our community. I also appreciate the examples that you were giving, because it does show not only what we're saving on police time, police calls, but also that we are stopping hospital visits. And in this time of COVID, any stress we can take off of our healthcare workers and less exposure for people is really important. I just really appreciate the examples and seeing that we're having what I would call in the first 2 days and one morning, some great successes in the program already. So just my heartfelt thanks for everyone that worked on getting this together and getting it going.
Great. And Mr. Contos, you also had your hand up and I noticed it's not anymore. Did you want to ask a question or make a comment?
I did, and it was answered. Thank you.
All right, great. So I don't see any more hands up from any council members. I will quickly give the public an opportunity if they want to make a comment. This is just a simple update. Yes, Mr. Davis.
Thank you. I was trying to get to the hand raised. Just real quick, if I may, Chair, just kind of wrap this up a little bit on our end, just for some terminology. We had some great discussions about the name and involving crisis in the name, and we went back and forth, but just so kind of what we're putting out in the press and what we are is we've created the Missoula Cares program, and the vans that are responding to these incidents, we're referring to them as MST. It's our mobile support teams. And so just so we're all on the same page for terminology is we have a Missoula Cares program, which is the overall program with the partnership between Partnership Health Center, Missoula Fire, and everything encompassing in that with the case facilitation and follow-up. And the 2 units that are responding are the mobile support teams. And that's that licensed counselor with the EMT in the van. And then I want to take, this is a monumental moment. We've heard that several times for the fire department. And I'm really proud of this department and this community with taking this approach. And between our mobile support teams, our ARU, and the way we're changing the way we respond to emergencies to be more efficient, to be more cost effective, and better serve the public. And I just thank you guys so much for that support. And it's been so awesome and successful changing the way that fire has responded and EMS and law enforcement has responded for forever and ever, and being on the forefront of that. So thank you guys so much. And I'm just proud to be a part of it.
Well, thank you so much, Assistant Chief Davis and Randy and Terry over at Partnership Health Center. I don't see any public queued up, so I will send you off with, again, my heartfelt thanks from myself and my fellow council members and from the community. We are so fortunate to have people who care so much. I think Ms. Becerra said that very eloquently. And thank you to all of the council members who voted for this additional funding and for the budget this year that allowed for this program to get off the ground. It not only serves our community better, it's a better use of our precious tax dollars. And I think that just in the last couple of days, with the examples that Randy gave, we are serving our community better and more efficiently. And that's really what we all strive to do. Thank you so much, Terry, for joining us and for your partnership and your work and many years of service. We've all seen you in various roles. And any other, I think that seems to be it for this portion of our agenda items. Thank you again so much. And we'll look forward to having you back, AC Davis, in a few months with another update as this this Missoula Cares program, I'll make sure to use the right terminology, continues to serve our community and hear an update for that. So thank you so much.
Thank you.
So we're going to move on to our second agenda item for today, which is a continuation of the ordinance to restriction of the display of tobacco products and the sale of flavored electronic tobacco products, and on the unlawful transaction consisting of selling or giving tobacco products to youth under the age of 18, which is the full official title of that particular ordinance. So a quick kind of overview of the order of operations that we're going to go into. We are going to hear a little bit more from the sponsors, Ms. Becerra and Ms. Jones, and the health department on the revised ordinance. We will continue to take questions from council members on the revisions I will hopefully then somebody will make a motion on one or on the ordinance. We'll then move to comments on the ordinance, and then we will move to public comment. And like I said, we have just a little over 2 hours for this. We will take a break in the middle of all this because 3 hours is a little too long to sit in front of a Zoom screen. And for those folks who are looking on the online agenda, want to point out a couple things. If you look at item number 14 on the attachments, that particular item is the red line version of the ordinance. It has the original language and then the revisions that the sponsors are bringing forward. And then item number 15 on the attachments is the kind of what we call terminology clean copy, which would be the ordinance that we are potentially moving forward today if a motion is made. So, all right. With that, I'm going to turn it over to Miss Becerra and Miss Jones and the health department if they want to I know there was just a few tiny little language changes. Bring us up to where we are today, then I'll move on to questions from council members. So Ms. Becerra, if you'd like to take it over.
Thank you. Yeah, thank you. I just wanted to provide a brief recap of the evolution of this ordinance and what is before us today. In October, we introduced an ordinance to restrict the sale of all flavored tobacco products. That comprehensive ordinance was introduced to council for consideration because it is one of the most effective known paths to addressing the tobacco addiction that is and has been affecting our community. We heard public comment on the pros and the cons of such an ordinance, and after much consideration and review, this council sees the merits of an incremental approach to dealing with this issue. The ordinance before you addresses what has been at the core of this issue, which is preventing young, very young, and sometimes too young Missoulians from accessing a tobacco product and nicotine delivery system that has become an epidemic in this community. This ordinance focuses, or I should say the amended ordinance that's before you today, focuses on restricting the self-serve access to all tobacco products and prohibits the sale of flavored electronic tobacco products. Now, what makes these products different and in some ways more dangerous is the comprehensive array and flavors and packaging specifically targeted to children. The ability of children to conceal and use these products anywhere, including parks, playgrounds, and schools, makes it incredibly difficult to control. So in response to that, this amended ordinance has narrowed its scope to address what we know for a fact is an epidemic in Missoula that requires attention now. This ordinance has also incorporated a section that penalizes transactions of these products with minors. If a person knowingly engages in transactions of these products with a minor, this person can get fined. This ordinance also includes a severability clause so that if needed, parts of this ordinance can continue to be enforced independently. And also, I just wanted to remind everyone that implementation and enforcement of this ordinance will, like any other health and safety related ordinance, include an education and outreach component. So if approved, our health department is incredibly knowledgeable in this topic and will work with retailers on the best ways to uphold this new ordinance. We have updated the potential effective date to reflect a potential adoption date. So that is briefly what has transpired since October. And if I left any important aspects out, or if Ms. Jones, you want to add anything else, please do so. Thank you.
Thanks. I think that was pretty comprehensive. We spent a lot of time going over this revised ordinance during our last committee meeting. Really wanted to give time for the community to digest it and see what the changes were. And I think today, a big point of today is being able to take public comment on it, since this is definitely a revised ordinance. I know there's been a lot of comment in the public, lots of information in the newspaper. I think we all appreciate that. I think we're all trying to have an ordinance that we can enforce, that will stand up in court, that will truly have an effect on stopping the youth vaping epidemic and trying to address that issue. So I don't really have anything extra to add at this point. I think we just want to hear what comments are today, and if council has comments or any other thoughts on this. Thanks.
All right, thank you, Ms. Jones and Ms. Becerra. Would either of the folks who are on the line from the health department, I see Shannon and Arwen are with us. Do you have comment that you would like to make to kind of frame where how we found ourselves here today, and on the comments on the revised ordinance that the sponsors are bringing forward?
Stacey, this is Arwen. I will just comment that an incredible amount of work has gone into this, and I really thank Gwen and Mirta with all the work that they put into it. And again, the health department continues to support all work that has been presented as of today. That's it.
Great, thanks so much, Arwen. Shannon, do you have any comments?
Yes, I don't want to take up a lot of time. I do want to echo what Arwen was saying, that we think that it is really important to have some steps forward in order to address the vaping epidemic by youth, and really appreciate the work by Mirta and Gwen to try to find a good solution for moving this forward that could make a difference in our community.
Great, thanks so much. Okay, folks, so I'm now, if council members have comment or questions for the sponsors as well as the health department on the revised ordinance that they are bringing forward to you all, this would be an opportunity to ask those questions. And just again, to highlight for folks who are watching or online that we're talking about, it's going to be attachments number 14 and 15 is what we are talking about right now. So you are quiet. Okay, Mr. Hess.
Thanks. I wonder if there's been any consideration of next steps, if kind of in response to the incrementalist approach, what would cause the next increment to be, what would be the trigger to have us take another bite at this issue? And I wonder, so that's the first question, and maybe the sponsors or the health department could address that. And also, as a component of that, have you considered including any triggers within the ordinance, where if usage rises over time, youth usage rises over time or doesn't drop over time, there's an automatic trigger?
Thank you for those questions, Mr. Hess. And I think Ms. Becerra unmuted herself, so I think she can take a stab at these.
Thank you. Let me know if you want me to raise my hand. I'm happy to do so. I'll take a stab at that. Yes, Jordan, that's a really excellent point. And it has always been my intention that we build the data, the connection that's needed in order to show that a comprehensive ordinance will ultimately be the best way to deal with the issues associated with youth and tobacco consumption and addiction. But I think right now I think we need to take a look at this again, and we can establish a time at which we can look at this and say, how has this ordinance been performing in our community? What are the consequences, the benefits of having an ordinance like this passed? And then assess the situation and see if we can move forward with a comprehensive ordinance to include other products. In terms of triggers, I haven't gotten that far, but certainly that's something that we could consider at some point.
Thanks.
All right, thank you, Mr. Hess. Ms. Cheryl.
Thanks, and I appreciate Jordan's question, because that's one of the things that I have been thinking about a lot, of, you know, what we have seen historically in the tobacco industry is that they're one step ahead of us, right? Sometimes that they are coming up with things like Juul, and then we have some regulations around Juul, and then there's some other product that somehow slips through the cracks. So I would just, as we look at this policy and we think about taking incremental steps, that we have something in there that we really kind of look at those incremental steps as we move forward, and we think about, you know, as we see the tobacco use survey coming out, the risk, what is it? It's called the Youth Risk Assessment Survey or something. Anyway, that we're looking at as a community and as a state, that we think about those additional products that could fall through the cracks of some of these ordinances, and not just in Missoula, but around the country. That wasn't a question, but that's just a comment.
Okay, so I was trying to tease out there. Oh, right. So ideally, the order of operations is I would have wanted a motion before going to public comment, but it seems like at this point in time, our council questions have been answered. So I guess we will, Ms. West.
Sorry, so many buttons to push. I'm happy to make the recommended motion so that you have a motion on the floor to allow for public comment and input.
Great, thank you so much. So to clarify, Ms. West, we are moving forward the revised ordinance motion for final consideration on Monday night, look at my calendar, 23rd. Okay. Great. So now that we have a motion on the floor, I'm happy to take comments from council members on the said motion as we, and then I will move to public comment. So if you want to tee up in the public comments side, I will move to you next after we have some comments from council members on the proposed ordinance that's on the floor. Ms. Vasika.
Thank you. Now that there's a motion on the floor, I would like to amend the motion to omit the section 8.38.050, the sale of flavored tobacco products used in or with electronic smoking devices prohibited. I asked that we omit that section because all the other parts of this, where me and some of the vape store owners are already okay with. A lot of us already thought that having the self-service in front of the counter was already illegal. So if this will get the folks or the kids who are illegally possessing this from the stores, get that out of their hands, and we are absolutely okay with that. We can absolutely move that forward. The part where the sale of flavored tobacco products with the electronic smoking devices, we say that this is to help the kids not use these products. But what this is doing is leaving the adults who have successfully reduced or even stopped their smoking habit completely in the dust. This is a huge win for big tobacco. The vape store owners that I've talked to say that none of their products in their stores have come from big tobacco. A lot of the big tobacco lawyers and attorneys have stopped helping the local Missoula vape stores because they won. This will absolutely push all the people who used the e-products back to cigarettes, back to menthol cigarettes, back to cigars, back to cigarettes. This will put everybody who's tried to stop, they'll go back to cigarette use. This will increase the amount of people that are using cigarettes. I kindly ask everyone to think about that when they vote on this amendment to the motion to omit this section. Thanks.
Okay, so That is in order. Ms. Vasika has proposed an amendment. I'm going to take a wild guess and assume that the sponsors are not going to take this as a friendly amendment, correct? As a sponsor of it, I would agree that we are not going to. Okay, so we will now have discussion. So we are now going to have discussion from council members on Ms. Vasika's proposed amendment to omit that section. So Ms. Becerra.
Thank you. The reasons behind the proposed amendment proposed by Ms. Vasika essentially makes the argument for having the original comprehensive ordinance, which she opposed. So I, as a compromise, as a way to incrementally address this issue, we have the ordinance that's before us. So I cannot understand why we would not include that section. And for that reason alone, I cannot support it.
All right, thank you, Ms. Becerra. Ms. Merritt, welcome back.
Thank you. Sorry that I had to run there. I agree with Ms. Becerra. I don't support this motion. The opponents of this ordinance have simultaneously argued that we're cutting off access for adults who use vaping products as a product that they perceive as less harmful than regular tobacco products. And they've argued that kids are just going to go to the internet and get these products anyway, so it doesn't matter. We shouldn't bother with this ordinance. Only one of those things can be true. Either adults can get stuff on the internet or kids can get stuff on the internet. It's just not, it's not a consistent argument. It doesn't make logical sense. So adults who are using these types of products as they see fit and then they believe that will be less harmful to them. The science hasn't borne that out just yet. Maybe it's true, but they can also get those products online. We're not forcing them to go back to regular tobacco products. And the argument about kids being able to get them online, yes, that's true. We're not going to stop every avenue of kids getting these products, but at least it puts one more barrier in their way. And that's the best that we can do. Thanks.
Thank you, Ms. Maris. Ms. West. Oh, you're on mute, Ms. West.
Okay, there we go. Yeah, I'm just gonna, I'll echo what I think Ms. Becerra and Ms. Merritt have said. I think since we have been discussing this ordinance and hearing from the public, I think a large amount of the comment has centered around the use of vaping product and flavored vaping products specifically, and especially the use among our youth, even within the public school setting. We've heard from teachers, we've heard from, parents of high schoolers, and I think that this is the core of the issue. It's the thing we have heard the most about, and also where we can have the greatest impact. And so I feel like removing this part of the ordinance just would be counter the goals of this ordinance. And I agree that having things behind the counter is so common sense. It's almost silly to have to put it in writing, because I would have operated on the same assumption that this shouldn't be, these products shouldn't be in reach of anyone that isn't legally allowed to purchase them. So I think we do need more than that, though.
Thank you, Ms. West. Okay, so before I move on to a couple more comments from council members, I want the public who all have their hand raised to know that you will I need you to lower your hand and just raise your hand if you want to make comment on Ms. Vasika's proposed amendment. And then you'll be given an opportunity to raise your hand again to make comment on the broader ordinance if it is or is not amended after we deal with the amendment that's on the floor. So thank you so much. And Miss Cheryl.
Yeah, thanks. I just wanted to, as we look at this amendment, I just wanted to remind council members that this is not, vape products are not FDA approved as cessation devices. So there's a lot of conversation about that. That is not something that is recognized. You know, and when we hear about some of the statements about youth, about stores not selling to youth. The bottom line is right now that youth are reporting they're only getting 2.7% or 2.8% of their products online, yet we actually have an epidemic. So we have a kind of tragic number of youth that are vaping right now. The vast majority of them are not getting those products online. So that means that local retailers, whether they're selling to them directly or not, which I don't believe they are, I think they're trying to be really safe about it. I absolutely believe that. They're still profiting from it if they're buying them and getting them anywhere locally. As the parent of teenagers, it is harder for them to get something online. They need to have a credit card. I know you can get around some of these things. They need to have a credit card, which a parent can look at that statement, and they have to have them delivered someplace. So I think that just putting it behind the counter is not enough to protect our youth.
Thank you, Ms. Cheryl. Ms. Harp.
Thanks. Appreciate all the comments this morning. Sandy, I had a question for you. Since the last time we discussed this matter in committee, I have not had a chance to at all visit a vape-only type of store. And I'm wondering if you could just kind of share with us what kind of products they're selling, because is it really just down to the Virginia tobacco flavor and menthol, or are they still selling that wide variety of candy, fruit flavored type of things?
I can't really answer that question specifically. I do see some folks in the audience that would be able to. If the Tony is the Tony that I think it is, then he would be happy to answer that question. Also, if anybody else in the audience, I don't know if Ms. Anderson will allow that, but I think that they're better equipped to answer that question.
Thanks. I asked the question in particular because when this first ordinance came before us, I was scared beyond belief that there were all these very tempting flavors out there. And at my visits that I've made to convenience stores, I learned that it wasn't necessarily the case. So I'm just trying to understand where we've come along on the spectrum, and as well as trying to learn where this can lead to incrementally over time. So thank you.
Thank you, Ms. Harp. Okay, so that concludes comments from council members on the proposed amendment. I'm now going to go to the public, and so please keep your comments to the proposed amendment that Ms. Fasica has put on the floor, knowing that we will come back to you for comments on the larger ordinance. So I will start with, as I see you in my screen, Philip Gardner. You should be able to unmute yourself and provide comment on the proposed amendment.
Thank you. You have to deal with the flavors in e-cigarettes. You take anything away from what I say here today, the question is, are flavorings generally regarded as safe? And the answer is no, not for inhalation. What we call aldehydes toxicologically are primary irritants to the mucosa of the respiratory tract. The punchline is that lungs have a different spectrum of toxicity than the intestinal tract. Substances known to be safe when swallowed can be dangerous when inhaled. So all these flavors that we're talking about are aldehydes, and they're toxic, and they're particularly toxic when they interact with the lung. We've talked about menthol both in regular cigarettes. I'd also encourage you that menthol also makes it easier to smoke or vape products. It has a cooling sensation, has an anesthetic effect. It actually activates neurotransmitters in the brain, and menthol allows greater cell permeability, meaning it goes deeper into the cell than if it didn't have menthol in it. Certain flavors like cinnamon maldehyde suppress bronchial epithelial cells. We actually have data on this, published studies on this. Actually, e-cigarette sweet flavors create more, what do you call it, cavities in teeth. We have published studies on this. Actually, the use of diacetyl, what is used in making buttered popcorn, also leads to popcorn lung, and that many, if not most, but many of the e-cigarette brands have diacetyl in them. I would encourage you that e-cigarettes have, and a number of the council members have already said this, are not proven to be a cessation device. And it's true that some people have gotten off this, but I think if you can take any step at this time, this would be the exact wrong amendment to make, is to actually leave the flavors in. In fact, you should be finding a way to get all flavored tobacco products off the market. And I'll stop at that.
Thank you, Mr. Gardner. We'll continue moving on, and I would ask folks, I meant to say this at the very beginning, but please try to limit your comment to 3 minutes. So Mr. Earl Allen, I think you should be able to unmute yourself and provide comment on the amendment.
Yes, hello. Hopefully I hit unmute and you can hear me. I just directly, I do plan on commenting on the overall ordinance, but to the amendment in particular, and to something that Councillor Harp mentioned, I do believe there is a difference between what's available in vape shops and what's available in convenience stores. Federal law and the FDA has already eliminated a large number of flavored vapor products that have been available to our business types earlier this year. And as a matter of fact, I think they've done more with some of their pre-market determinations as late as September. So there may be something, you know, between the two business models that's different. And basically, just to wrap this comment up, I'm curious to know if council had considered something of a, you know, say vape shop has a 21 and over, you know, policy where they don't allow, you know, youth in the front door, if, you know, similar to what you would want for maybe a tobacco shop or something, if that was a consideration. So that's my quick comment on that. I will have more later. Thank you.
Thank you, Mr. Allen. Next, we have Mike Kiefel joining us again. You should be able to unmute yourself.
Yes, Ms. Anderson, thank you very much. It's Michael Keefe again. And I wanted to thank quite a few of the city councilors for recognizing that the vape shops have taken a lot of steps to prevent access to youth. At my store, Liberty Vapor, here at 1609 South Avenue West, we do not allow anyone under 21 to be in the store. Like, not even if it's a minor that would be sitting in the car, you know, with the air conditioning on. If it's 100 degrees, like that's still not okay for a minor to be in a store that only caters to adults and only carries products that are marked specifically as underage sale prohibited, 21 plus, circled in a little red thing. And I also wanted to speak very briefly as to the information that some of you may have being out of date. There are currently studies from reputable organizations like Johns Hopkins School of Medicine that are gaining a lot of traction for this industry, not only with the use as a nicotine cessation aid, but also just the fact that this is a currently legal product that we are selling to the legal adults. In my store, everything is behind the counter, everything is behind glass, nothing is self-service or even accessible to people. We have blue tape lines all over the floor that say stay 6 feet away from my glass. It's a little ridiculous that we are still being prosecuted over the crimes of other people's kids. But to the amendment in particular, None of these are marketed to children. The children cannot come in here. What I believe to be the source is Snapchat. We have some people that are running a black market organization through social media where they say, I will be at this location at this time, pay me this much and you will get your fruity flavors. So yes, it is through the internet. They're not using direct sales. They're definitely not coming here and getting it. We've passed every single inspection by every government agency and every single Moms Against Whatever organization that wants to come in our doors. I will reserve all remaining comments for the remainder of public comment. Thank you.
Thank you, Mike. Let's see, Matt Cully.
Hi there, can you hear me?
We can, thank you.
I am speaking to support Ms. Viseca's amendment. I'm a Kalispell resident, but I am a board member for Consumer Advocates for a Smoke-Free Alternatives Association. It's called CASA. I got oral cancer in 2012 from smoking, and after many failed attempts, vaping was the only thing that helped me quit. And if you look at a lot of the polling, over 90% of adults are using flavored products. And part of the reason that is that you when you quit smoking, you want to disassociate yourself from the taste of tobacco. You also get a lot of your taste buds back. So, you know, the tobacco flavoring and e-liquid just does not taste good. And so, you know, it's good to acknowledge that flavors are vaping. It's part of vaping. And what we've seen in other cities when these ordinances happen is all the vape shops close. So to answer Miss Merritt's comment where she said that the arguments were inconsistent, I vehemently disagree with that because yes, the savvy vapor will be able to go online. Maybe some teens will be able to go online. But the person that gets screwed in this is the grandma that's 60, 70, finally quit smoking with a flavored product. And then her local vape shop closes and she goes back to cigarettes because it's all she knows. So, you know, it's a very regressive war on drugs style policy. All it does is push things, you know, deeper into a black market. And if you look at countries that have universal healthcare, like the UK, they have completely adopted this as harm reduction. There's even vape shops in a few hospitals in the UK. You know, people think that's crazy. I always tell them to Google it. It's there. I've literally seen them with my own eyes when I've traveled over there. And, you know, they view it as harm reduction. Now, the argument that there's aldehydes in these flavorings is completely disingenuous and doesn't look at things on a spectrum. All the research that's been done on flavored products shows that there is vastly lower amounts of aldehydes in vaping products compared to cigarettes. So, you know, I hope that you guys all keep this in mind and understand this isn't a progressive policy. People try to paint it as that. It is very regressive and is a 90s style policy. Thank you.
Thank you, Mr. Cully. Carly Schaefer.
Hi, this is Carly Schaefer with Great Western Petroleum. I just wanted to say I agree with Ms. Viseca on this. Just quickly to summarize that if this were more of a broad ban, this would be effective. But since it's only within these city limits in the 5-mile radius, you're just shifting the business. So the kids are going to continue to get their stuff, kids, adults, whatever. The biggest problem is you're going to shift the business outside of city limits, which isn't that far to go to Florence or Frenchtown or wherever. And right now, local small businesses are already struggling. And what you're basically going to be doing is closing down those vape shops because that's all they have. And they're just struggling to feed their family right now. So, like I said, if it were a broader ban, I think that would be more effective than just trying to do within these limits. You're basically just choosing one or the other. Thank you.
Thank you, Ms. Schaefer. All it says is Tony on my screen, so you should be able to unmute.
Hello, can you hear me?
Yes.
My name is Tommy Dobbs. I am the owner of Liberty Vapor. I just want to say that we strongly support this amendment by Mrs. Viseca. As Ms. Merritt had just said, this will drive all of these businesses or all of these sales to the internet. And therefore that leaves us with no business, and we will be shutting our doors, and I will be laying off my 4 employees that I have that are struggling right now in this tough time that we're all in. I just urge you to really think about what you're doing right now. Thank you.
Thank you, Tony. Denver. You should be able to unmute yourself and speak.
Yes, thank you very much, Chairwoman Anderson and members of the City Council. I appreciate the amendment that was offered by Ms. Viseca, but I've got to tell you, as a 20-year tobacco user, I have tried e-cigarettes and I have tried vapes, and they do not work. They didn't work for me. I don't know how many other people they didn't work for. For me, it just made me want a real cigarette. And within a week, I bought another pack and I was back on the wagon. The other thing I just want to say is this argument between city and county and state and federal is an old argument and continues to be made over and over again when it comes to any kind of legislation. And what I would encourage you to think about is this is within your jurisdiction now. You can't control what the county does. You can't control what the state does. You can't control what the federal government does, but you can have some control of what happens in our city. So thank you very much.
Thank you, Mr. Henderson. Dr. Kathy Rogers.
Thank you. As to gutting this amendment by taking out the flavors, tobacco's the leading cause of preventable disease, disability, and death in the United States. And cigarette smoking is a major modifiable health risk. Flavors actually enhance addiction in whatever form. And that's why when the 2009 Family Smoking and Prevention and Tobacco Control Act banned flavors for conventional cigarettes, except for menthol, it made a tremendous difference in the use for adults and kids. And adults who choose to smoke, that's their choice. There are many adults who would prefer not to, and anything that helps them to change their habits, I'm sure they appreciate. But this is more about our children who this flavor adds to the addiction that nicotine brings. So to not remove flavors is not taking care of the problem. So we need to think about that from that perspective. Thank you.
Thank you, Dr. Rogers. Next, we have a phone number ending in 070. Phone number ending in 070, you should be able to unmute yourself and provide comment on the amendment. Okay, phone number ending 070. Looks like you might be having some technical difficulties. I do believe it's *6 to unmute yourself. Let me look at my notes here real quick. *9 to raise your hand, *6 to unmute yourself. All right, we'll give you a minute to work on that. We'll go on to the next person and come back. Oh, looks like you're unmuted. Hello, phone number ending in 070.
Can you hear me now?
We can, yes, thank you.
Okay. Good morning to all. My name is Erin Kepler, and I manage the Zootown Super Stop on Higgins Avenue, next to the college and in between 2 high schools. I've spoken a couple times during these meetings, but wanted to add just a couple more thoughts. Rather than adopt a ban on the sale of the flavored tobacco or vaping products, I feel like the city should focus its efforts on enforcing location-oriented bans that are already in place. For example, flavored tobacco products are not allowed in the high schools in Missoula, yet we hear that students continue to use them in school. The school district should provide further enforcement personnel and resources to high schools and impose higher penalties for students who are caught using tobacco products at school. Beyond this, the city could also ban use of tobacco products at public parks or other locations where youth tend to congregate, such as the mall, Yet to be effective, such location-oriented bans need to be enforced. So there will be a need for foot patrols at parks and higher fines imposed that can help to deter flavored tobacco use by the youth. Billboard campaigns could also be helpful in informing youth and families about any adverse health impacts. My point here is that this is a collective issue that our community needs to solve together. The solution should not simply fall on the shoulders of small businesses and their employees, given that these products have already been vetted and approved for sale by adults or to adults. The city, parents, schools, public health officials, and small businesses all need to band together and come up with fair solutions in which we all contribute together in solving the issue. It is not fair to kick the can down the road to small businesses, given that we have already been on the front line following the law and not selling these products to minors. It is vital that the city explore collective and shared solutions and not pinpoint or put the burden only on small businesses alone. Thank you so much for hearing my points this morning, and I truly hope you vote against this ordinance and rethink other solutions.
All right, thank you for your comment. Thomas Reisberg, you should be able to unmute yourself and provide comment on the proposed amendment. Was what we're taking comment.
Hi, this is Beth Morrison. I'm probably using Thomas's access. So if it's all right to speak. I just want to point out real quick that the anecdotal stories and the prediction statements you're hearing do not equal evidence to support this amendment. The original ordinance proposed is based on facts that are based on replicated peer-reviewed research and data. And I believe personally that small businesses did not go into this industry to help people quit, of which there's no evidence. They went in to make money off addiction. So I ask you to please not support this amendment. Thank you.
Thank you so much. Jeffrey Berry should be able to unmute and provide comment on the amendment.
Council members, thank you for listening or letting me speak. First of all, I am from New York State. I wanted to relay some information regarding current flavor bans in our state. One, just to answer the previous caller, I have been a consumer advocate and a business advocate for this industry for over a decade. I did get into this business to help other people quit because I smoked for 22 years. So I just had a doctor's appointment, full evaluation. I smoked for 22 years. My physician can't tell I smoked ever. So as much as the anecdotal disproving, you're trying to disprove anecdotal studies, I smoked for 22 years. Last week, my doctor just told me she could not tell I ever smoked. I did get into this business to help people quit smoking. Also, to relate to social media. If anybody has any interest, I can provide pictures of Snapchat sales. I have multiple amounts of transactions via Snapchat that I have researched. So tobacco also, the one doctor said tobacco is the leading cause of preventable death. I 100% agree with that. Vaping is not. Even former FDA director Scott Gottlieb said that vaping is harm reduction. Now, with that being said, I fully endorse Sandra Vasecka's amendment. And I hope you take in consideration my comments.
Thank you, Mr. Berry. We have Lenata Peppers. You should be able to unmute yourself. Lenata Peppers.
Good morning.
I hope I pronounced that right.
Yes, yeah, you did.
Great.
So my name is Lenata Peppers. I am a citizen of Ward 6. I am Northern Cheyenne and Crow. I'm a mother here in Missoula. I'm here today to ask you to adopt an ordinance that restricts the sale of all flavored products. This personally affects me because we are Native American. some of my youth are LGBTQ+, and we are low income. And so we have 6 youth who live under this roof right now who are actually targeted by this industry. By putting barriers in the way, I know it's harder for my kids to get stuff. As a mother, obviously, it's hard for them to get stuff online. Half of them can't drive, so they can't leave the city limits to go get them from other communities. But somehow, even with the restriction, even the fact that they're not even allowed to go into the gas station themselves, one of my teenagers did bring home a vape that they had found on the ground that was in perfectly fine shape, which we confiscated and took away. But this led to a conversation with my family where we talked about the toxicity of these products, as mentioned earlier, and how this is an epidemic, but we actually have 2 epidemics here in the city right now. We have the epidemic of our youth getting a hold of these products, as well as the COVID-19 epidemic. And because we have so many youth using these products right now, they would actually, according to a Stanford study, have substantially heightened risks, 5 to 7 times more likely to get COVID-19 and have worsened symptoms. And so we're looking at the actual epidemic of kids getting these, along with the actual study of heightened risks to these children. So because this is addiction that can be heightened with flavor, and because this is preventable, like we could protect our kids from this, I think that the city should move to make sure that this is as preventable and that we can save our kids from getting worse effects from COVID-19 and from getting these products. I also want to mention that the business has pointed out that people are getting this on Snapchat. Where do you think the people on Snapchat are getting their products? They're getting them from the stores here. They go and buy them, they take them to the point, and then they sell them to the kids. So, you know, it would be much harder for people to do that if we had this ban.
Thank you, Ms. Peppers. We appreciate your public comment. We have Meredith Berkman. Should be able to unmute yourself and provide comment on the proposed amendment to the ordinance.
Thank you so much, City Council members. My name is Meredith Berkman. I'm a co-founder of Parents Against Vaping E-Cigarettes, and I've been honored to speak to you several times now on this topic. And what we would urge is that there be absolutely no exemptions to the policy of banning all flavored e-cigarettes and all flavored tobacco products in Missoula. And I say that on behalf of our national organization, but also on behalf of the families that we represent, the 3.6 million families across this country that include families in Missoula and in other cities in Montana. Those are the families whose lives have been upended by the youth vaping epidemic. And I just want to address that we have been working with parents on the ground in cities and states and localities all over the country. And there are so many that have passed these laws because they understand, and as has been said on this call, that flavors hook kids. And I just want to answer a couple of things that were said earlier. One gentleman talked about the UK and the harm reduction argument made in the UK. I just want to point out that the nicotine levels in the UK, in the EU overall, are much, much lower than they are here in the United States. I believe they're below 3% nicotine outside of the US in the EU. And so when you look at the UK studies and you look at the problem that they don't have, that we do have of the extent of the youth vaping epidemic, we have to realize it's apples and oranges. These are products that provide enormous amounts of nicotine that are highly addictive with flavors that are able to addict kids. I also want to point out, someone earlier made reference to then FDA Commissioner Scott Gottlieb talking about his quote, supporting the notion of harm reduction. He also said later on, we did not foresee the extent of what he was the first to refer to from FDA as the youth vaping epidemic. And I want to amplify what the woman who just spoke as a parent and talking about the targeting of at-risk communities. We're all talking about the targeting of kids. We are talking about targeting that is online. We are talking not about, I applaud those retailers that spoke here and said, we follow the rules, we don't sell to kids. But the problem is that so many others do not follow the rules. And we know that. We encourage parents in every city and state to report underage sales to minors. But the problem is the kids are getting the products. And the most recent NYTS, National Youth Tobacco Survey study, points that out. We have 3.6 million kids all over this country who are getting this stuff. They're using flavors. 8 out of 10 kids are using flavors. That woman mentioned LGBTQ teens and tribal communities. Menthol flavor has been used by the tobacco industry to target African-American communities and the LGBTQ community for decades. Menthol vapes are now being used by over 37% of teens who are vaping on a regular basis. Those teens are 4 times more likely to turn to combustible cigarettes. The research shows kids will migrate to flavors available. Those kids are going to migrate to flavored cigarettes. The flavors are the problem, and we would urge you not to make any exemptions. I hope you'll be hearing later on from one of my personal heroes. It is a retailer from a nearby city, from Bozeman, who I know has spoken to you before, who has talked about his decision to not sell any tobacco products because he understood that this was his chance to take a stand and protect kids. And as I'm sure he will tell you, and as he recently said on our organization's podcast this week, in fact, he did not lose business by stopping his sale of all tobacco products. The community appreciated it. They appreciated his protection of children. So I just want to applaud you for taking this issue so seriously. And I want to urge you to protect the kids of Missoula and all of our kids by having no exemptions on the sale of flavored tobacco products. This is the only way we can end this epidemic and protect younger kids from starting. We see that all over the country, every place where we have parents testifying, in small towns in California, to someone was speaking from New York State. All of these products, the kids are getting them. And I know everyone on this call wants to protect kids from a lifetime of nicotine addiction. And this is the best and most efficient way to do it. And we have to start somewhere. It has to start on the ground in the cities and states of this country. So thank you very much.
Thank you so much. All right, we have Brianna Hansen. And remember, we are taking comment on the proposed amendment to the ordinance. And if you try to keep your comments to as close to 3 minutes as possible so we can get through everyone and get back to discussion on the main ordinance, I would appreciate it. Ms. Hansen, you should be able to unmute and provide comment.
Okay, you hearing me?
I think you were unmuted. I heard a tiny little voice.
Maybe I need my volume up. Let's try that. Is that better now? Can you hear me?
I know you're speaking because I can hear a faint whisper, but it's not audible.
Speakers, let's see. Maybe I'll just take off my headphones.
Oh, there you come. Here you come.
There I am? Okay.
Well, you were getting better. Whatever you were doing was working.
Whatever I was doing I came in closer. Does that help?
Yeah, I guess, come as close as you can, speak as loudly. There we go.
Is that better?
Yes, there we go.
It was my headphones. I was just logged in with headphones. Okay, perfect. Thank you all. I've really enjoyed, by the way, getting to see the city council, because this is the ordinance that has actually brought me to advocate for our youth in Missoula recently. And I'd never come to a city council meeting before. So I've been in the loop, and I am representing elementary health enhancement teachers here in our Missoula County Public Schools. I am a health enhancement teacher. That means I teach PE and health K-5 at a public school in Missoula. And I have created curriculum that deals with education behind vaping. And I am here to say loud and clear that I do agree with others that if we only create a ban on certain flavored e-products versus a ban on all flavored products, we are supporting the industry of the big companies that are using all the marketing practices that they used 50 years ago with the tobacco industry. And I feel like if you look at the big picture, we have to make small gains in small towns to give the big industry the bigger picture. They'll move to something else to try and get people hooked on nicotine. We know this. We've seen that just cigarettes in general aren't used as much by people, but now nicotine is back in the scene because they've learned out a new strategy. Vaping, you know, it sounds like it includes water, but we all know that it does not, those of us who have been educated about it. And it can cause someone to be addicted within a week, literally, because they're getting so many more times the amount of nicotine than they would if they were just trying one cigarette. My point being is that this is something that we can change in our country, and we can be role models for the rest of the world. And I really think that we need to make sure in Missoula, Montana, we make our mark and we put a ban on it. And unfortunately, I don't like that it could affect convenience stores, but it's really not saying no to them. It's saying no to the marketing strategies of our big companies. And we want to have healthy youth that can make decisions for themselves and prevent long-time health diseases that will haunt them and potentially cause their life to be shorter than it should be. Thank you so much for hearing me out. And as health enhancement teachers, we want to keep inspiring these kids and with healthy choices. Thank you so much.
Thank you, Ms. Hanson, and thank you for your service in our public schools. We have Christopher Colburn.
Hey, can everyone hear me okay?
Yes, we can.
Great, so make sure. Just want to say thanks for the opportunity to provide comment. I appreciate you taking the time to hear this. My comment is, I think a little bit of both in response to the amendment and also overall the ordinance you consider. So as I said, my name is Christopher Colburn, and I grew up in Missoula. I was educated by the Missoula Public Schools and got my undergraduate degree, my undergraduate and graduate degrees from UM. So I care deeply about Missoula, the community that raised me. And so I am really grateful that the council is taking action to protect what I hope will be all Missoula youth by passing a comprehensive ban on all flavored tobacco products. Currently, I live in Bozeman, Montana, and work for a healthcare system. I also serve on the Gallatin County Board of Health, so I understand the challenges of making decisions of this scale. That said, as a public health professional, I know restricting the sale of harmful products designed specifically to attract youth is in the best interest of community health. Flavored tobacco products of all kinds serve one primary purpose: to get young people to use the products and keep them using for the rest of their lives. And it's important to note that that effort is intentionally focused on exploiting already marginalized youth. I don't know this from the years and years of both research and literature that affirms it, but I know it because I lived it. I'm Black, I'm queer, and I grew up in a low-income household. I was the target audience, and I received all the messages that were intended for me. This is a health issue, yes, but it's also an equity issue. The opportunity here is to both protect the community and to stand up for the values of justice, diversity, and equity that this community cares deeply about. Specifically, it's an opportunity to dismantle a piece of the oppressive framework that has successfully been used to push folks to the margins and keep them there. It's a way to push back against generations of systemic racism and the health inequities that continue to persist because of it. And finally, it's a way in which we can affirm that we care about the health and futures of queer youth, of low-income youth, and of youth of color. The science is there, the evidence is there, the historical and contemporary context is there. And I think the shared understanding that we have to do better is also there. I feel really strongly that now is the time to act, and I hope that you all will all consider a comprehensive ban on flavored tobacco products. Thanks for the time this morning.
Thank you, Mr. Colburn, for sharing your story and providing comment. So we have one more person in the queue, and then I'm gonna last call for queues for providing comment on the amendment, and then we will get back to the ordinance at stand. So Michelle Arthur.
Good morning, can you hear me?
We can.
Hi, good morning. Thanks for allowing me to speak. So my name is Michelle Arthur. As you guys know, I work for Town Pump. I've been with them 26 years. I'm the director of loss prevention, travel plazas, and tobacco for Town Pump. I'm also a mother of 2 successful young adults. My daughter is in the military, and my son is the head distiller at Lolo Creek Distillery. So I thought I'd put that plug in there. I was born in Butte, born and raised, lived in the Missoula area for the last 17 years, moving back to Butte last year. So I am familiar with the great community of Missoula. I just want to say that, again, we do ID, as do all of the other retailers. And I want to thank Ms. Cheryl for believing in us. And I appreciate that comment. We all locally have a successful pass rate as far as carding and not selling to minors. Your decisions put the burden on our local businesses, resulting in a significant loss in sales to legal age customers. I want to know what the health department and community leaders plan to do to educate our youth. What are the consequences for a minor in possession? We teach our youth that we need to teach our youth that there are consequences for their actions. And I haven't heard in here, whereas if these children are possessing these items, what are the consequences? And I think they need to be heavy. We got to have a little tough love and teach them at a young age that if they do break the law or do something they're not supposed to, there are consequences. They need to learn that at a young age. What is the plan to build local relevant data to gauge the impact of any ordinance? As far as the argument that the legal and underage can both buy online, sends a message that there is still access, and the fact that local businesses pay the price in Missoula falls on deaf ears. I did not appreciate that comment, because it's okay if we still have access, we're just going to send it elsewhere. It has not really been that long ago that we were all in school, whether it was high school or junior high or whatever. I don't care how old we are, we remember when. We have not seen, or had we had not seen at that time, that if there is a will, there is a way. So if you wanted alcohol, you got alcohol. You found a way to get it, whether it was accessible, legal, or not. I really think that whether there's access or not, if they want it, they're going to get it. Does everyone remember all of the heavy education in the 80s regarding drinking and driving? There was very visual printouts, posters, videos. There were gatherings in the gym where you would watch these horrible shows of what could happen if you drink and drive. And they showed that at a young age, and it was very impactful. We had a recent one with the Meth Not Even Once campaign. So if we believe this is that dangerous, where is the education? And let's make it heavy education that's going to be impactful and stick with these kids. Kids believe they're invincible. They don't really understand what's going to happen tomorrow, nor do they really care, right? So we need this to be impactful, and them to believe if you vape, here's all the things that are going to happen to you. It takes a village to raise our children. We need to focus on parenting and being adult leaders and developing junior versions of ourselves. We need to be involved in what our children are doing, having a safe place for kids to congregate, like Miss Cheryl's house, which she deeply misses with COVID, where the kids hang around the kitchen table and visit. We need that for our kids. We need to be involved in who they're hanging out with, allowing open conversation with our youth, whether we're the parent, the teacher, the coach, whatever. We have some great teachers at Hellgate and Sentinel that have spoken up and said they visit with the kids during class about these things, and they have those conversations. Those people are safe adults that these kids can talk to and understand what's going to happen if you put one of those vapes in your mouth. Banning products will not work. We need to take a proactive education and leadership role to deter youth use of all illegal products. And again, I thank you for your time, and that's all I got.
Thank you, Miss Arthur. Okay, great. Miss Mr. Gardner, I see that your hand is up, but we are trying to limit comment on the ordinance to one bite at the apple. You'll have an opportunity to provide public comment again on the larger ordinance. So with that, we have had public comment. We've had discussion from council members. I think it's time to move to a vote on Ms. Vasika's amendment to ban section. You want to provide the number again? We all know what it is basically, but
It was section 8.38.050.
050, grant. Okay, so we are voting on whether or not to pass Ms. Vasika's proposed amendment to the ordinance. So I will do the roll on the vote. So first, awkward when you're the first one up, but I vote no. Ms. Becerra.
No.
Mr. Contos.
Yes.
Ms. Harp.
Yes.
Mr. Hess.
No.
Ms. Jones.
No.
Ms. Merritt.
No.
Mr. Ramos is absent. Ms. Sherrill.
No.
Ms. Vasika.
Yes.
Mr. Von Lossberg.
No.
And Ms. West.
No.
Great. Okay. I'm gonna do some math on the fly here. So 1 absent, 3 yeses, and 8 noes. The amendment to the ordinance fails. Okay, so now we are back to the main motion, which is the proposed ordinance. It is 10:58 by the clock, sorry, on my computer. We've all been sitting here for nearly 2 hours. I do think it's time to take a quick break before we move into public comment on the main motion. So if the folks on the call want to queue up for that, we are going to take a 7-minute break. And if we could all be back in front of our screens at 11:05, I would appreciate it. So we stand adjourned till 11, or stand in recess, sorry, till 11:05. Okay, folks, it's 11:05. I'd love for you to rejoin us. Okay, as council members pop back on the screen, we have 55 minutes left in today's Public Safety and Health Committee meeting. We need to hear public comment on the proposed ordinance. I do realize, though, that we did not have an opportunity to have any more comment from council members, as Ms. Fasica's amendment was first out of the chute. So council members, if you have comment that you feel it needs to be made today that can't wait until Monday, please raise your hand and I will call on you to provide additional comment. Ms. Fasica.
Thanks. Ms. Arthur brought up a really good point. What are the consequences for the youth that are illegally obtaining these products? I know that if they have alcohol, they get a minor in possession ticket, which includes a fine and community service. I called up the police station and asked if youth do have tobacco products, if they do get an MIP, and the person did say yes, they are supposed to get an MIP. Does anybody in this committee know the enforceability rate of that? Like, do they actually get MIPs, or do they just get a slap on the wrist and the person who gave it to them gets in trouble?
I do believe it's both, and I think Ms. Jones probably can speak to this in regards to the ordinance does have a clause in there if you are so-called middleman of purchasing the electronic vaping flavored electronic tobacco product and then selling it to minors, as well as we reference state law in regards to what happened if youth is caught with it. But Ms. Jones, I'm sure you can expand upon that.
So if you are a youth and you are caught using tobacco, it is an MIP. It's a charge against the youth. And so it's not just a slap on the wrist in terms of, I mean, maybe some of the officers use warnings, I'm not sure, but there definitely are MIP cases that are brought every year in Missoula County. What my experience is, from what I've heard from police officers as well as administrators and teachers at the middle schools and high schools, is that it's very hard to catch, because it's not like in terms of vaping, it's a very different product than if you have a lit cigarette that you're walking down the hall with. These are very small products. They are odorless. There is no smoke that comes from them. The kids can have them in their shirt sleeve, sit in the back of class, and literally be doing it in class. And if you can imagine having 30 to 35 kids in your high school class that you're trying to teach, it's very hard catching someone sitting in the back with a small product like that really doesn't give off many signals. So they are certainly aware of it. They periodically see it as to whether it's hard to catch and enforce. The police officer literally has to see it in front of them. But as all of the information is gathered in by the administrators and they discuss it with each other and they see snippets here and there, they're probably just seeing the tip of the iceberg. And it's like somebody slipping a piece of gum into their mouth in the back row of the classroom. Pretty hard to catch. So I know we've heard a lot of comment about the youth need to be punished for this. I think there is structure in place if a youth is caught. And we also have the middleman clause, which is someone who's legally buying this, 21 or older, be it off the internet, from stores, wherever, and then turning around and selling or giving it to youth. That is a big part of this ordinance that we've included, because that is not okay. They definitely should be punished. That's a big problem. And the legislature had not really addressed that as we looked into it. And we thought that's an important part to include in this ordinance, because that's a big gap, frankly. So that's why that section is in there. So I hope I answered your question.
And I have a quick follow-up, if I may.
Yep.
I know people who use these, and it's not odorless and it's not smokeless. Just FYI. And I'm done. Thanks.
Okay, great. All right, so I don't see any other hands up from my fellow council members, so that will give us the opportunity to move to public comment. So we'll now start taking public comment on the proposed ordinance. Once again, that is item number 15 on the attachment to restrict the sale and display of tobacco products and the sale of flavored electronic tobacco products. So this is the revised ordinance that the sponsors are bringing forward that we are considering here right now. I would ask that folks please try to keep your comments to 3 minutes. I will be trying to time. I hate to interrupt, so please be mindful. We want everyone to have an opportunity to speak. If you have more lengthy comments, please feel free to email them to us at council@ci.missoula.mt.us. That goes to all of us. If you have more lengthy comments that you would like to give, you could just please give us the abridged version for 3 minutes. We do this so that everyone has an opportunity to be heard. So I will start as you appear on my screen, Pamela Cutler. Pamela Cutler, you should be able to unmute yourself and provide public comment. All right, we'll give you a minute to work out your, I think you should be able to just unmute yourself. But we will continue on and we'll come back to you. I'm trying to make sure that we get through everyone because we will have to come back to council members for a vote. Mike Keefe.
Yes, thank you, Ms. Anderson, again. I will try to keep this as brief as 500 words and try to read as quickly as possible. If we as a community are so outraged by the fact...
Sorry. Mike Keefe, I apologize. When in an effort to lower your hand, I muted you. So please unmute yourself. I apologize. Mike Keefe. Okay, let's see if I can ask you to,
Thank you. Sorry, I lost you.
Sorry about that. That was my fault. We'll start your time over. Please begin from the beginning.
Thank you. If we as a community are so outraged by the fact that children are breaking the law, why do we not seek to hold them accountable for their choices? These are the private choices of individuals. We can argue semantics on the age of reason, which is known as 7, and the legal responsibility of a child for their actions, but certain facts remain. All school children take health classes where they learn about the dangers of certain substances, including nicotine. As far as I am concerned, they intentionally broke the law, knowing and accepting potential ramifications. The current verbiage of the MCA lists fines that are too lenient to prevent recidivism and deter new offenses. It does provide the option for community service and cessation counseling. Requiring such sentencing for such crimes in this jurisdiction would reinforce the existing laws and holds a better hope to addressing the issue of underage use without impacting the rights of law-abiding consumers. Why do we protect and mollycoddle criminal youth while repeatedly slandering and targeting industries that do not allow children on site, carry only products marked underage sale prohibited, and have not broken any laws? You may argue for or against my rights and what they are, but they are inalienable. This is a republic and no amount of democratic process will rob me of my rights. I will see you in court. In my pursuit of happiness, I quit smoking 2 packs of Marlboro Red 100s each day and instead choose to consume my fruity nicotine with as few as 6,995 less chemicals. I run 3 miles faster than I did in the military and my asthmatic lungs have never felt better. I am currently using the lowest strength nicotine liquid in my process of quitting. To rob others and I of our right to choose to go to hell in our own way would likely send myself and 1/10 of all residents back to the monopoly you would create for the combustible tobacco cartel, which legally murders 5 million people each year. I might remind the city that they may be held for treble damages under the Sherman and similar antitrust acts. The health consequences of cigarettes are known to be far worse than those of vapes. See Johns Hopkins study. Yet you have literally protected them more than the industry that seeks to end their use. Our 9th Amendment to the US Constitution says that the enumeration of certain rights shall never be held to mean that other rights not listed are not retained by the people. Limits exist for a reason, and residents should never have to wonder about the limits of city power on unincorporated county or private lands. The city is 35 square miles, but the ordinance would cover an area of hundreds of square miles of county land. I fail to see how you have the authority to pass such verbiage. If you ban all flavored e-liquids other than tobacco flavors, you will ban 420 of 454 different nicotine liquids in my store. This is a lot higher than the 30% loss of indoor sales that you made exception for with convenience stores. If the city is playing favorites and choosing how and when to apply the law instead of uniformly applying the law to all, I think I need new city officials. Thank you.
And thank you so much. And you did make it all of those words under 3 minutes. So great. Thank you so much. Miss Pamela Cutler, were you able to unmute yourself?
I think so. Can you hear me now?
We can. Thank you so much.
Great. Thanks everyone so very much. So I'm Pam Cutler, Dr. Pam Cutler. I live in Ward 3, and I am the president of the Montana Medical Association. Here in Missoula, I'm the chief medical officer and president of Western Montana Clinic. Thank you for your time and the thought that you are spending on this topic. I want to begin by just saying, like with the current COVID situation, I really believe that politics and business interests are having an increasingly unbalanced influence on public health. Science is being outweighed and frequently misquoted. The truth is, what's healthy and what's protective is the same, no matter the politics or the financial impacts. So no matter what you've heard today, remember, all tobacco products harm all users. And we're here because youth vaping is a huge problem. So the decisions that you make about kids' access to tobacco problems really matters. And any public health gains for youth make a huge difference in the long-term health of our community. Long past my term as the MMA president and long past your terms on city council. This ordinance is for the future. So based on solid public health benefit, the Montana Medical Association supports restricting all products and all kids, protecting all kids, excuse me. I urge you to take the steps to protect them, beginning with this ordinance. Thank you very much.
Thank you, Dr. Cutler. Next up in the queue, we have Dr. Rogers.
Thank you. I do want to say how much I appreciate what the council has done and what you guys are doing and listening to all of this and all the work on trying to make this work for as many people as possible. I have to say Dr. Cutler made some really good responses. And the other thing that I want you guys to know is the data shows that punishing kids is less effective than positive reinforcement. And the developing brain is designed to seek out rewards, which nicotine and nicotine laced with flavor trigger, so that those developing brains, despite what you want to do to punish them, are driven to try and find things that light up their brain, which flavor does. When you lace it, nicotine with flavor, those kids go for it. It's part of what happens during development. No, we all can remember back to things that we did that we now go, oh my gosh, what was I thinking? So I won't review the whole physiology of the developing brain, but the big part of this is that by limiting access, by removing flavors and those reward mechanisms that the brain is given, we take that off of the table and allow our kids not to be tempted until they get old enough, smart enough, wise enough to hear the words that the teachers are saying, that the law puts forward. And we have to build this into the system. I think the other thing that I want us to realize is that Montana kids use chew and menthol and other flavored tobacco products, not just the flavored vapes. And so it's a part of the culture. And until we remove those, we continue to provide them with access. So it's my hope that you guys can go ahead and move forward and pass this in its entirety. But thanks again for the work you have done and the time you've taken to listen to all of us.
Thank you, Dr. Rogers. Denver Henderson, you should be able to unmute to provide comment.
Thank you again so much. I appreciate the opportunity to speak. So for the record, my name is Denver Henderson. Last name is spelled Henderson. I live at 1720 Cypress Court. I just want to share a little bit about my own personal struggles with tobacco. And for the record, I'm a strong proponent of the ordinance and I appreciate the sponsor. So I started smoking in high school. I started smoking because my friends smoked. It was a social thing to do after school, on the weekends, during a break at work. And I continued smoking right through college. At the time, I told myself that it was my choice. I wasn't addicted. I didn't need to smoke. And then my 20s gave way to my 30s. And I continued to lie to myself and say that I could stop anytime I wanted. But I didn't. Since then, I've tried quitting several times with varied and limited success, sometimes for a couple months, at one point for 2 years. But eventually I would always backslide and I would always start up again. What started as a choice quickly became a compulsion. Today I'm 38 and trying once again to kick this terrible habit. The last time I smoked a cigarette was on September 28th. It's been just over 50 days. In my waking life, I feel good about myself. I'm able to exercise more easily. I'm losing weight and sleeping better. But for weeks, I smoked in my dreams. And I worry it's only a matter of time before I slip up and start smoking again. Like generations of smokers, I got hooked before e-cigarettes were created. This is because the industry has always found ways to get kids hooked on its products. Before e-cigarettes, it was candy-flavored cigars and chew and menthol cigarettes. Flavors are what attract kids to try tobacco, as other people have said, and what makes tobacco easier and more pleasant for them to use. Tobacco on its own is an offensive taste and smell, and were it not for peer pressure and clever advertising, I think very few would start. But this is the business model. Hook kids with flavors when they're young and before they knew better, and tobacco companies will have repeat customers the rest of their lives. Decades later, many of us are still working hard to quit. In closing, I wish I'd never started. I can't take that back. I wish my community had been looking out for me. So let's help prevent future generations from getting hooked. Let's restrict all flavored tobacco products and protect all of our kids. Lastly, I just want to acknowledge that this may be a tough decision for some of you, but you were not elected to make easy choices. This is not the kind of movement that can start anywhere. We can't expect leadership to come from the legislature, and the federal government has failed to act in a decisive and consistent way. It has to start at the local level. It also won't start in any community. It won't start in Hamilton or Kalispell or Great Falls or so many great cities and communities across our state. It will start in a place like Missoula. And in order for others to follow, you have to lead. So I ask you to be bold and to be brave. And when the time comes, please, please support this important ordinance. Thank you for your time.
Thank you, Mr. Henderson, and we wish you luck making it to 51 days tomorrow. Mr. Earl Allen.
Thank you. Can you hear me?
We can, yes.
Very good. Thanks, Chair Anderson and members of the council. I really have to say I really appreciate all the effort and the time you've put in on this. There are passionate voices all around, and I think we all can appreciate that. And I appreciate the time that you've taken to hear those of us in the convenience retail community and taking the time to discuss or answer emails or even come down and visit. And I just wanted to reiterate the invitation remains open. When things get back to more normal circumstances past COVID and the times we're in, I'd still love to see members of the council come into our stores and see what we do, the effort we put in to avoid selling age-restricted products to of any kind, flavored or not, tobacco, alcohol, the effort we put in to maintain our 98% gold standard of compliance when we're checked. I'm proud to say yet again, since our last meeting when I spoke, we've had another 2 compliance checks passed. So I'm proud of our crews and that kind of effort that they put in. To bring this quickly back to the question of incrementalism that you all had discussed earlier, I would like to remind council that a lot of things have changed since some of the information that you've seen from advocates. I think advertising nationally and both in stores and that kind of thing has been far more restricted. The FDA late last year raised the age to attain these products from 18 to 21. That was in December. The Congress and the FDA. The FDA has, like I said earlier in my comments, has removed several products already from our shelves and our ability to obtain them. There are a lot of things that have already been happening this year. And I think that momentum is continuing. There are pre-market determinations from the FDA. Those of us in the convenience industry are looking at standards to beef up our register systems, to not only double check the IDs, but also to limit the amount of products that can be sold to any one individual, to sort of, kind of clamp down on the availability to middlemen. I think, if I'm correct, I think the FDA is also considering some new rules on some more graphic warnings on packages. So the momentum is there. I appreciate where you folks have ended up. I know that's not perfect for everyone. And I only have one other kind of thing, kind of a, it may be sort of a very small thing, but one of the things I noticed on 838-080, Section A, number 4, there's some teeth in here about those of us in the retail community. It's basically saying failure to comply results in, the ability of the city to pull or deny a renewal of a license. And I would simply ask that maybe you look at that and say something about repeated failures, because while I know we keep that gold standard up, I also know that we are humans and nothing is ever perfect all the time. And I would hate to think that council would allow language that would kind of create a one and done situation for retailers, whether intended or not. So, but anyway, again, I appreciate all the work that's been put in, and can appreciate where you've ended up on the issue. And just remember, we're here, we're part of your community. We care for our youth just as much as anyone else. I'm a proud graduate of Hellgate High and the University of Montana myself. So I hope you continue on. Thank you.
Thank you, Mr. Allen. Jeffrey Berry, you can be able to unmute. Jeffrey Berry, please.
Oh, can you hear me?
We can. Thank you so much.
Okay. Council members, thanks for hearing me again. Like I said before, I am from New York State. I am only here to advise council on the detriment of a full blanket ban. I had 3 shops in New York for over a decade. The full flavor ban went into effect July 1st in New York State. It closed approximately, out of the 700 stores, it closed roughly probably 250 immediately. I tried to survive, and I chose not to do so. I have traveled extensively across the state to numerous vapor stores that have tried to comply. What I have found myself is that they're just not complying. It's under the table, under the ground, the back door, online sales. I mean, it's the blanket ban simply does not work. I moved my stores. I'm proud to say I moved my stores both 1 mile over the PA border. I am lucky enough to live on the border, and I'm doing better than ever. They simply just come over to New York State. However, like I said before, I can provide all kinds of social media sales. It does exist. It is primarily the number one, in my opinion, the number one access to youth for vaping products. That is not going to stop. Your ban will not stop. Your flavor ban will not stop that in a small city. They'll simply go outside city limits. That's just fact. I'm experiencing it. It's here. So the teenagers, the youth use in the schools in my area has not stopped. The ban has done nothing, less than nothing. I do know also that the combustible cigarette use has gone up, where it was slowly going down. It's gone up 2 or 3% in the last 6 months, just from personal data I can find. So, excuse me, I just have to touch base with my notes here.
You're closing in on 3 minutes, Mr. Berry. Got 2 minutes.
Oh, it's simply you're going to lose taxable revenue. You're going to have storefronts close. You're going to have jobs. These are responsible outlets that are selling these products. You've heard testimony from all of them. The products aren't 2% maybe. The products aren't being received to children from these stores. That's just simple fact. I mean, you've heard the testimonies. All these responsible outlets are doing their job. It's coming from other places.
Great. Thank you so much for your testimony. You're over 3 minutes and we want to keep going. Mr. Gardner.
Thank you. And I didn't properly introduce myself in the first place. I'm Dr. Philip Gardner. I'm the co-chair of the African American Tobacco Control Leadership Council. We're based here in California, but we work nationally, whether it's in Missoula or in Baltimore or in Atlanta or in Kansas City. I've worked on the New York flavor bans and the Massachusetts flavor bans. Having said that, I'll say in short, menthol and flavors make the poison go down easier. That's why they put it in cigarettes in the first place. And if we really want to protect our youth, and I think the council wants to protect their youth, then they should eliminate those products from being available to kids. We know that menthol is an anesthetic by definition. It allows for deeper inhalation. The deeper you inhale, the more toxins and nicotine you take in. The more toxin and nicotines you take in, the more addicted you become. There's a lot of misinformation going on out here. I would encourage the council to put the health of their citizens above the profits of the tobacco industry. When we completely stopped the sale of flavored tobacco products in San Francisco, we had very few shops have closed. This has been 2 years going. People aren't going to go out of business. When they said people were going to stop flying on airplanes if you didn't allow smoking, that never happened. We stopped having people smoking in bars. Bars didn't close. I don't want you to fall for the same rhetoric that has been going on for some time. Let me address another issue, and I want to say this as strongly as I can. We should support the decriminalization of tobacco products. We shouldn't always turn to that. We should fine somebody, lock somebody up, penalize somebody for doing something that the tobacco industry has been, frankly, pushing down our throats for the last 70 years or so. I want to strongly encourage you to come up with things other than penalizing these people, whether it's community services, butt cleanups, educationals, or else. And lastly, in the midst of the COVID-19 pandemic, there can be nothing more effective, nothing more promising than establishing and putting in place strong public health measures. With this, I want to encourage you. I've written you letters. I've spoken here to you. And someone said it right. If it has to start at the local level. If you're going to wait on the county, the state, the federal government, you'd be waiting a long time. Thank you for your time.
Thank you, Dr. Gardner. Jennifer Newbold.
Hi, can you hear me?
We can.
Great, thank you. I also want to echo everyone's comments about thanking the council and the committee for all of the time that you've spent really carefully considering this and trying to figure out the best way to make it work. I am a former MCPS school board member, and I'm a mom of a high schooler, middle schooler, and elementary schooler here in Missoula, and a resident of Ward 1. And I want to urge you to not stop short of the ultimate purpose of this ordinance. Really, we need to keep in mind that the purpose of the ordinance is to protect our community's kids. And as we know, kids are inappropriately targeted with these flavored products. And the targeting is, although vaping has gotten a lot of attention and it is an epidemic, the targeting is not limited to e-cigarettes. And the data that you have shows that a number of our Missoula kids still chew, use flavored cigars, and smoke. And menthol and flavoring make these products attractive and palatable. And I think the idea is that we want to put in place an ordinance that makes these things not attractive and not palatable and not allowed for our kids. We have a responsibility to our children that really outweighs any other competing interests. And this ordinance, I think, is a tool that's really narrowly tailored to prevent the use of these flavored products, including menthol. So I just want to encourage you to lead on this issue and to do the right thing and keep the interests of our kids at the forefront when you consider how to best protect them from the dangers of flavored tobacco products, including menthol and flavored cigars. Thank you so much for your time.
Thank you, Ms. Newbold. Annie Teagan. Should be able to unmute yourself.
Thank you so much. Good afternoon. I applaud this. My name is Annie Teagan from Campaign for Tobacco-Free Kids, and I applaud the City Council for taking action in Missoula. And I wanted to say, I think I said it before, but you're not alone. Nearly 300 communities have acted to restrict flavored tobacco. They've faced strong opposition from tobacco dealers, retailers, and the industry. There's a lot of pressure to exempt certain products or flavors. And most recently, though, the vast majority of these cities have passed these policies, and they've ended the sale of all products, all flavored products, despite that pressure from the industry. So I would urge you to consider the strongest possible policy today. The bottom line is that these products should never have been allowed on the market in the first place. These initial puffs, the minty and sweet puffs, seem harmless, but they lure young kids to start, and the nicotine hooks them for a lifetime of addiction. You hear anecdotal stories from smokers switching to vapes. First, the science disagrees. E-cigarettes are not proven as cessation devices. Second, these adults can still vape unflavored products if they choose to, so this ordinance won't deter that. And that's a small price to pay for preventing kids from getting hooked. And everyone on this call probably knows someone who died early because they were addicted to tobacco. And if we can prevent that, I mean, my goodness, why wouldn't we? The lifelong addictions they cause lead to premature deaths. And maybe your mother or your dad or aunt or uncle, they have died early from tobacco use, whether from cardiovascular disease, emphysema, lung and other cancers. These people are saying goodbye in hospital beds, wishing they'd never tried these flavored products in the first place. Just like the man who testified saying he smoked in his dreams, he certainly wished he never started. And the federal government has failed to take action to protect American youth. The weak actions they have taken are really not helping at the federal and state levels. They're simply not working. So it's up to local city and county governments to step up and lead the way. So I really hope that you'll do that today. Finally, I'd just like to say thank you for doing the right thing, sticking up for Missoula's kids. I hope you choose to. And this is partly a thankless action. Kids alive today in Missoula, they'll never know what could have been. They will never say thank you. But decades from now, you can think back to this moment and know that there are grown men and women out there, 50s and 60s years old, who instead of getting addicted, getting sick, and instead of holding their daughter's hand in a hospital room with maybe lung cancer or having had a heart attack because of tobacco addiction, instead of all that, those people who are now kids in Missoula and will then be adults will be living full, healthy lives. And they won't know it, but they will have you to thank for all that. So I say thank you for considering the strongest ordinance possible. Thanks for your time.
Thank you, Ms. Teagan. Amanda Cahill. Amanda, you should be able to...
Okay, it said I was unmuted and then it put me back on mute. Hi, thank you. I'm Amanda Cahill. I'm with the American Heart Association here in Montana and a parent here in Missoula as well. The American Heart Association is a nonprofit, nonpartisan organization that seeks to build a world of longer, healthier lives. And with that in mind, unfortunately, this current ordinance as written, where it only includes the electronic products, is not something that we currently support. And it's with it's with a lump in my throat that I even say that, but that the reason being is this leaves, specifically here in Missoula, more than 400 kids, really at the mercy of big tobacco and their tactics for hooking children with these flavored products. We know that more than 400 kids right here in Missoula are left out with this policy only being around electronic cigarettes. This current policy as written also doesn't really protect our kids from the next big thing, right? It was all the fun flavors of cigarettes, and then it was menthol, and now it's vape. And what's the next thing? Is it, something we sniff up our nose or something that melts on their tongue? What will it be? And this really doesn't protect us from how savvy and smart big tobacco is, and how they will do anything to keep children addicted to these products. We again are severely concerned about the switching from vaping products to traditional flavored tobacco products, as you've heard from many doctors and many representatives of the minority and LGBTQ communities. We really do see kids switch to the flavors. They follow the flavors. So that is really our biggest heartache on this. The AHA, does these ordinances across the country. We work on these, and we really have to stay strong and look at what's best and not leave kids behind. What we could certainly support would be something where it is a phase in, where we look at doing this for electronic products now, and then we set a date to phase in all other flavored tobacco products that target our children. So I would really encourage you all to consider that, and we really thank you for your time and attention to this serious issue. Thank you.
Thank you, Ms. Cahill. Lindsay Stroud.
Hi, can you hear me?
Yes.
Okay, awesome. Thank you again, Council, for bringing up this important issue. My name is Lindsay Stroud. I am the founder and creator of Tobacco Harm Reduction 101. And I'm also a volunteer board director with the Smoke-Free Alternatives Trade Association. I did send testimony, so I'm gonna be pretty quick and just kind of go over some main points that I wanted to address. While it's laudable to address youth use of age-restricted products, bans are pretty ineffective, and they also reduce tobacco harm reduction options for adults. It's really unfortunate too, because Montana spends so little on programs to help smokers quit. In 2019, the state spent only $5 million on tobacco control programs. There's over 139,000 adult smokers. That amounts to $35.85 for the year for each of those smokers, and it's even less for youth. Youth use isn't as bad as everyone's kind of making it out to be. According to the 2019 Youth Risk Behavior Survey, nearly 70% of high school students reported not using an e-cigarette in 30 days prior to the survey. They also asked why they were using these products. Only 7% cited flavors. 13.5% reported using an e-cigarette because their friends and family use them. 25.9% cited other. Montana, Missoula tobacco and vapor product retailers are actually doing a pretty good job in not selling to minors. Between February 22nd, 2013 and February 14, 2020, the FDA sent out 555 compliance checks letters. This is where they use a minor to go into these shops and try to purchase a tobacco or vapor product. Of the 555, only 9 resulted in violations, and only 4 of those involve vapor products. They also involve pre-filled cartridges. As you may be well aware, that the flavored ones of those were banned in January. Existing flavor bans are still kind of new, but some of the data doesn't show that they're as promising as everyone hopes there to be. San Francisco banned flavors in April 2018. Youth vapor use increased, so did youth combustible use. In 2017, 7.1% of high school students reported using current use of an e-cigarette. This increased to 16% in 2019. Combustible cigarette use also, current use increased from 4.7% in 2017 to 6.5% in 2019. And so you really don't want to see children starting to get combustible cigarettes. And this has also been examined in an April 2020 study among 18 to 34-year-old people. And they found a significant increase in cigarette smoking after the flavor ban. As I said, there's testimony in there. I wanted to be quick. I know you guys have a lot more, and thank you again.
Thank you, Ms. Stroud. So folks, there's 11 people in the queue. We have about 16 minutes left in committee. We are not going to get through everybody. So I want to just point that out to encourage people to be quick, concise. And if you've already commented at all of our other committees, maybe think about referencing that and letting folks who haven't spoken have a chance. So Charlene, I'm sorry, I don't know. This is it's hard to see where the first and last name start. I think it's Charlena Panama. I know I butchered that and I apologize.
Hi there, can everybody hear me?
We can, thank you.
Hest Quex, Jenya, Quasquata, Charlena, Piname, Bisawis Quest. Thank you for having me this morning. I'm a member of the Salish tribe. I'm here to talk on behalf of all the Native children. And I'm really thankful that you guys are all taking this time to work on this issue. Commercial tobacco products is the only product out there that, if used as directed, will kill you. So with just knowing that fact, we should all take time to make sure that this ban is passed. As a Native American elder woman, I'm really concerned about restricting only e-cigarettes, which leave the risk of kids using the products, especially Native American kids. The tobacco industry bought out American Spirit several years ago, and they use that to promote their products using our Native American icons, our language and everything, promoting that it's a safe product when it's not at all. In Montana, 13.2% of Native American high school students smoke cigarettes, including menthol, which is compared to a 6.6% of Caucasian high school students. It's a form of exploitation. It's based on our race and our culture. And it's important that we do not allow them to use our culture and our historical stuff to sell the products. So I ask you all to just take this very seriously, to protect our children and our community from addictions that take a toll on our mental health and our society for a longer term, because the addiction goes throughout their lives. And again, I hope that you take the time to restrict all flavored tobacco products. And thank you so much, Lemlens, for taking this time on this topic.
Thank you, Charlena, for your comments. We appreciate that. John. It just says John on here. I think you've spoken.
Councilor Anderson, the rest of the council, I appreciate you allowing me to speak. I will be very brief. My name is John Monahan. I'm the sales manager with High Noon Petroleum and Noon's Food Stores. And I actually would like to thank the council for their compromise on the ordinance as it sits now. I think that it's a very volatile, very emotional subject for everyone that is involved. I believe that the ordinance as it is written right now, we feel will have a much less deleterious effect on our retail locations. I also understand the desire for some incremental steps for other restrictions. And I would hope that as the council moves forward, I know that the retail community in Missoula would love to be part of that conversation. We would love to have a seat at the table. I think there's a lot of things we can do together to limit access to youth, not only just of vape products, but also of the other, when you look at restricted products, of course, in the retail world, we don't look at only cigarettes. We of course deal with with alcohol as well. So I think as much of an epidemic as vaping is right now, I think high school use of alcohol is probably at the same, if not a higher level. And we would just love to be able to work with the council. I appreciate everything that you've done. Councilor Anderson, I appreciate our conversation from yesterday. I know that you probably didn't plan on COVID in 2020 and you didn't plan on this committee being so overwhelmed with some of your things, and I just appreciate all the time and effort you put into it. And I would hope that you do pass the ordinance as written right now. So thank you for your time.
Hi. Oh. Sorry, someone just unmuted me. This is Lauren Wilson. Was I intended to speak next? Hello?
Stacy, I think you're muted. Stacy.
Yes, thank you. Yes, Ms. Wilson, I apologize for the abrupt transfer, trying to get people quickly through. So please go ahead.
No problem. Love it. So I'm a pediatrician. I've spoken to you guys before. I'm speaking as the vice president of the Montana chapter of the American Academy of Pediatrics. I really want to sincerely thank all of you. I know this has taken a lot of time. I appreciate how difficult your job is trying to balance all the varied interests that you're hearing on this call. And I know that this newest iteration of the proposed ordinance is an attempt to compromise. However, I am afraid that stopping short of restricting all flavored tobacco products will cause unintended harm. My organization urges you to restrict all flavored products, as do I. We know that kids who vape are more likely to go on to smoke. We know that tobacco addiction begins in childhood, that the majority of adult smokers start before age 18. We know that kids in Missoula do use the flavored chew, the cigarettes, and the cigars. All of these things are getting into the hands of kids despite everyone's best efforts, and that's really the point of having to escalate this issue now, which none of us love being in this position. I applaud the choice to address vaping, which is the most commonly used tobacco product, but I worry that restricting vaping without addressing the other forms of flavored tobacco will push kids increasingly toward those other products. We as pediatricians don't have FDA-approved modalities to treat nicotine addiction in the kids who are heavy daily vapers. So they might seek that treatment elsewhere by using other products. Also, this isn't a fair fight. Our kids are up against the resources of the tobacco industry, and to imply that they can fight the forces of advertisements and the flavors and the products that are specifically designed to target them is one that really just doesn't give them a fair chance. So I would say I don't think half measures, as well intended as they are really appropriate when we're trying to protect as well as we can. I appreciate the thought about having some outcome measures to look at later and to reevaluate, and I urge you guys to put those into place now. Please protect all of our kids, address all the products. Thank you.
Thank you, Ms. Wilson. Kristen, page 9.
Good morning, Kristen, page 9 with the American Cancer Society Cancer Action Network, resident of Missoula, Ward 1. And I again thank each and every one of you for this conversation and the work of the co-sponsors of this policy proposal. No, even just because of this conversation, people are contemplating quitting or attempting to quit. So know that all of our efforts here are helping people. Unfortunately, we have to oppose the existing revisions to the original proposal. And, you know, I've talked before, so I'm not going to reiterate the FDA banning of cigarettes and what happened when kids rolled over onto other flavored tobacco products. I do want to bring up another study that the American Cancer Society found, that the e-cigarette maker Juul bounced back from a dip within weeks after they removed the most of the flavored products from the stores. In fact, the sales went on to rise even higher than they were before that change was made, as buyers switched to the menthol, mint, or tobacco flavors that were still in stores. We can expect the same to happen when our community only stops selling one type of flavored product. And I'd like to end with a quote from Brian King. He is the Deputy Director for Research Translation for the Offices of Smoking on Health at the CDC. It's like whack-a-mole. If we stop selling one, the industry will continue to aggressively market others. It's the marketing that gets the horse to the water. It's the flavors that get them to drink, and the nicotine that keeps them coming back. Please not only consider doing what's best for the largest number of children, but those children that need your help the most. And when we just focus on this one product, we are leaving children behind. I ask you to reject the revisions and go back to the comprehensive definition. Comprehensive policy. Thank you for your time.
Thank you, Ms. Nye. Okay, folks, we are almost to the top of the hour, and And as I said, we weren't going to get to everybody. So for those folks who didn't have a chance to make public comment, again, I urge you to email us at council@ci.missoula.mt.us. And that goes to all council members. But we have a motion on the floor that we must dispense with. Ms. Vastika, do you have a question on the motion on the floor at the moment?
Yeah, there's an amendment to the part that Mr. Allen brought up. I wanted to make some changes to that. Will I be able to do that on Monday?
Yes.
To the violations. Okay, I'll wait till Monday to do that then.
Perfect. Great. Thanks so much. Okay, folks. So without any further council comments and seeing that we have a motion on the floor, I'm going to move to a vote. So this vote is to move. Oh, just under the gun, Ms. Cheryl. Yes.
Thank you. I just wanted to make a comment and just disclose the fact that I am doing work on a statewide level, not in Missoula, for the Montana Kids versus Big Tobacco. I'd just like to disclose that before we vote. Thank you.
Great. Thank you for that. Okay, folks. So what we're voting on right now is to move the revised ordinance out of committee for full consideration on the floor on Monday night, November 23rd. I have to keep checking on that. So that is what we're voting on right now. So I will call the roll, and I vote yes. Becerra.
Yes.
Contos.
No.
Ms. Harp.
Yes.
Mr. Hess.
Yes.
Ms. Jones.
Yes.
Ms. Merritt.
Yes.
Great. Mr. Ramos is not in committee today. Ms. Cheryl.
Yes.
Great. Ms. Vasika.
No.
Mr. Von Lossberg.
Yes.
And Ms. West.
Yes.
Okay, great. So the ordinance passes with a vote of 9 yeses, 1 absent, and 2 noes. So this will be up again in City Council on Monday night, the 23rd. This is a continuation of an ordinance that we have been hearing. So this will be final consideration of the revised ordinance, final vote Monday night. So again, for those folks who had their hand raised that didn't get to make public comment, please send us an email, or you can send us a voicemail. Voicemails can be sent at 406-552-6012, or again, council@ci.missoula.mt.us. Thank you so much, folks, for your time. I know this is a very long committee day. We have a short break before we then have committee of the whole at 12:30, and for the rest, and other committees for the rest of the day. So with that, I will adjourn today's Public Safety and Health Committee meeting, and thank you so much for your time and comments.